Good morning. Hope everyone slept well and ready for another provocative day, thought-provoking day. I want to tell you, if any of you that missed the session last night with Chief Mullen from Charleston, you missed a gift. So for those of you that were there, it was magnificent. He's still here, maybe in the room now, but I know he'll be here for the rest of the time. So hopefully you can have a chance to talk with him. The video you just saw, and I hadn't seen it before, of Dr. Lacona. He was a board member of ours that passed away in early 2016, I believe. And I had only had a chance to meet him once and spend some time with him because he was ill for quite some time. But the moment I met him, after I spent 5 minutes with him, it's like I was in love. I was in love with the man. And so this year, we announced last year, but this year we are giving out, or beginning a new award series for community activism for health. And we'll be giving that this evening for the first time at our reception. So I hope you'll all be there for that. It's a wonderful marker for us as an organization to start celebrating and congratulating those at the level of the community, at the grassroots level, who are being activists and champions for health causes. So we're going to get started on today, and it will be my pleasure to introduce the boss of my bosses, my board chair, Jerome Davis. Jerome is the Regional Vice President of the Colorado for Public Service Company of Colorado, which is an Xcel Energy company. And in that role, he has leadership responsibility for local government affairs in 165 communities throughout the state. He's on many boards. He works with a charitable organization in Xcel Energy. He is a native Colorado, native Denverite, a two-time graduate of Regis, the husband of Jackie and the father of Jasmine and Jordan. Please, and I know you will give my boss a warm round of applause. Welcome, Jerome.
Well, thanks, Karen, for that warm introduction. Karen's sort of been on the job, I think she said yesterday, going on 2 years. And would you all agree with me that she's simply been amazing? So good morning. I get to do a little bit of talk about inequity here. So I wanted to start off, first of all, and just sort of talk a little bit about acknowledging some of the very dedicated and passionate peers on the board of the Colorado Health Foundation that serve with me. I am very humbled to be in a leadership role with these individuals, and having worked very closely with them, they do a tremendous job on behalf of the foundation. So if they could, the board members that are here today, if they could stand up, please, and be acknowledged. In addition, I also think it's always extremely important to honor those that come from before us. I know we have some board members here who have served in the past. I'm not sure if any of them are here. I know there are at least about 7 of them here. If any of them are here in the audience right now, if you could please stand, prior board members. Great. All right. So what do we got here? A couple of good-looking kids. Certainly full disclosure, they certainly take after their mother. I don't have a problem at all admitting that I married up, so it's okay to state that. Great kids, though. Respectful, do things well. We don't have any issues with them. But I don't want you to think they're always great because they're both still on the payroll. And so I know all parents know what that means. We have not figured out how to get them out yet. So, nevertheless, they're working their way through it. They're both in school. They're both working. I love them dearly. However, what's unusual about these two kids is that they both are afflicted with a disorder called sickle cell anemia. And so that disorder causes sickling shape of the cells, red blood cells, which can cause problems in getting the oxygen to flow through the veins. And that can cause severe pain issues for them. They were diagnosed well within 2 or 3 months of their birth of having this. And so you wonder, well, why do I disclose that? When we're having these sort of courageous conversations, one of the things that I think is important is that you have to be sensitive. You have to show your own vulnerabilities. I'm a pretty private guy. I really have not even acknowledged this, even to our own board or staff, but that is them. But we've been very fortunate, my wife and I, and them. We've had the resources to get them the best health care, including preventive care, including mental health care in terms of dealing with something like this, and understanding the system of how we manage it and how we manage it as it relates to the dollars that are required of this. And as a result of that, they've lived very healthy, quality lives. So good that I would go as far as to say they've lived better lives than those that are healthy. So you ask me, okay, Jerome, what's the point? What are you bringing them up for? Well, I do like to show them off. That's one thing for sure. But the real reason is when I joined the foundation board, I really began to learn more about healthcare and this industry as a whole. And as I've learned more and more about it, particularly as we embarked on this new vision statement, I began to ask myself, well, what if? And I asked these questions about, would things be different for them under some certain circumstances? And so I really began thinking about that. What if they were diagnosed at a later age? Would their health care be any different? Or if they lived in a different zip code, should that have any determination on the kind of health care they receive? Background: white, brown, red, whatever. Should that determine anything? What our household income is, whether we're in the 1% or whether we're at the poverty level. Whether or not we have health insurance. What if they don't have access to healthy food? What if they're facing inequities that many Coloradans experience every day? What if we didn't have the ability to bring health in reach for them? More importantly, what if they didn't have all they need to be healthy? So this is real critical here. Because the truth of the matter is, I'm no better than anyone in this room, and neither are them. When it comes to health care, this is so critically different. We live in this capitalism of a nation. But the most important piece here about healthcare is it shouldn't make any difference in terms of what people receive in terms of that care. So none of those determinants should change what that access looks like or the type of care you get. Healthcare should be equal to all of us. And as I started thinking about this, it really got me committed to saying, hey, because we have the ability to provide this for our kids, I would have to think that every parent wants to have that ability for their kids, for their parents, for their brothers, sisters. We should not even be having this conversation, but we are. And so the great thing about this, that we're having the conversation, is for us to begin thinking through it from a personal standpoint. So I take it personal. And that's one of the reasons I did join this organization. It's personal for me. And I think what you've been seeing of it as regarding a theme from this symposium is how does it impact you personally? Because that's the first step. And if it does impact you there, then we want to begin joining the small groups and begin building this from the grassroots up. So I take it personal. I know our board takes it personal. The organization takes this personal. We are all committed to what this vision says, that across Colorado, each of us can say we have all we need to live healthy lives. That's what we want. And I want to know who's going to go on this journey with us. That's really what I want to know. So I'm really interested in that. Who over here wants to join us? I know this middle section isn't going to let them outdo them. See? All right, over here to the right. All right, how about all of us? Let's do this. Thank you. I really just wanted to give you a little bit of my own personal story and hope you get on the train with us. And I'm very enthused about seeing and hearing from many of you that you do want to do this, because I believe together we can make this thing happen. So let's go do it. Thank you.
Thank you, Jerome. As he said, he hasn't shared that before, so that's the first time I'd heard that about Jasmine and Jordan. So I have a few moments with you this morning, and I thought what I would do is spend some time reflecting on yesterday and responding to some of the comments, questions, feedback, critiques that we got from yesterday. So first of all, it was a full day. It always is at the first time. And we intentionally packed the first day with data. So if you felt like a fire hose coming at you, particularly when Derek was talking, I don't even know how his mouth moves that fast. But we will certainly get you his remarks. So we wanted to give you some data, a foundation of data. But in that panel discussion yesterday morning that Alan so wonderfully facilitated, he said that of the overwhelming theme of the questions that came up from the audience had to do with why are we focusing on or singling out race when there are so many other inequities. And so, of course, each of those people on the panel shared their perspective, but none of them, were speaking for the foundation. So I wanted to speak for the foundation and tell you why we're not focusing solely on race, but it is a prominent theme. So there are many reasons for that. Reasons include we have to start somewhere, and race is we believe, the most persistent, the most pervasive, and the most poisonous of all the inequities. It's one of the undiscussables. As a matter of fact, it's the granddaddy of all undiscussables. And if anyone should be brokering that conversation, why can't it be us? Why shouldn't it be us? Race is also closely connected to so many other inequities. So if you want to talk about education, which we're going to hear some about later this morning, you just have to scratch once and there's a racial inequity. If you want to talk about housing, scratch once, there's a racial inequity. And the list goes on and on. And the fact is we could work towards trying to solve some of those other inequities and never have to have the race discussion. But if we tackle the race discussion, we can also embrace and work on so many of the other issues. And one of the primary reasons is, as we talked about yesterday and as Jerome was also talking about, we said we want to bring health in reach for all Coloradans. And the fact is that the group for whom it is the furthest reach in this state are brown people, brown and black people. So if that's who we if that's who we want to focus on, we look at who's health the least in reach for, that's who, so that's why. That's part of why. In addition, as you all registered, we asked you, what do you want to talk about? What are you hoping to hear about at the symposium? And at the top of your list was the impact of race, racial inequity, discrimination, and its role in creating the health inequity. So those are many of the reasons, the main reasons why we have not a singular focus, but quite a healthy focus on race. And so when we look at our mission and our vision and who we have committed to be in service to and in service for and in service with, we are talking about low-income, marginalized, minority communities and immigrant communities, and that includes marginalized communities and low-income communities, includes low-income whites. And so for those of you who questions, where's that voice? Why isn't that voice at the table? We agree with you that is a voice that we wanted represented here today or this week, and it wasn't for lack of trying. We reached out to several of the national experts who have the national perspective as well as could bring, look at the Colorado perspective on low-income whites and the impact and the disparity that exists there. We just simply could not it didn't work for anybody's schedule. But it wasn't because we didn't try, and we certainly agree that that's an important part of when we look at marginalized communities. And I come from North Carolina, so in Appalachia, and I forgot who yesterday said, that I forgot what the statistic was. 1 in 7 people live in Appalachia. That was amazing. And even they get a name. They get marginalized. They're poor white trash. So they get marginalized with words that way. So yes, that is a population we are absolutely interested in, want to listen to, want to be a part of, helping them bring health within reach as well. So I wanted to comment on that. And then there was some comment around why aren't we talking about health? This is a health convening. Why aren't we talking about health? So my first reaction was, well, I disagree. We are talking about health. But then I tried to take a step back. So well, maybe it could be that we're in violent agreement, but we may have different starting assumptions. So our starting assumptions are that health and what contributes to a healthy individual, a healthy family, a healthy community is a myriad of factors. A myriad of factors beyond the current national debate on health care and health insurance. Those are critical components to what constitutes health, but I know I'm speaking to the choir when I say that only about 20% for what accounts for making us healthy has to do with what happens at the doctor's office or at the bedside in the hospital or at the pharmacy or in the dentist office. That there are all those other factors. So our starting assumptions are if we're talking about education, we're talking about health. If we're talking about safe communities, crime-free communities, we're talking about health. If we're talking about access to jobs, we're talking about health. If we're talking about affordable housing, we're talking about health. So if we're talking about discrimination and how that impacts stress and life conditions, we're talking about health. So those are our starting assumptions, that I don't know very many conversations we could have about any kind of life circumstance that doesn't have some kind of health impact. And it's the health impact on a family, on a community that we're concerned about. And that it doesn't necessarily have to be a health intervention to have health impact. Chief Mullen last night talked about seeing young people who would witness violence in their homes and the stress that causes on them, and how his police department brought in mental health professionals to help with that because he realized the health impact of his community because children saw violence, that it made their community less healthy. So that's how we would respond to why aren't we talking about health, and we think we are. The word may not be mentioned, but is it implicit in everything we do and everything we think about? And then there was a suggestion of, so why don't we make the symposium attendees mirror the demographics of Colorado? So when I worked at the Center for Creative Leadership, there is a program for CEOs and the C-suite called Leadership at the Peak, and it's designed for the most senior leaders. There's usually 12 people in a class, and typically there'd be 12 men, 12 white men often, or 11 men and a woman, and they would always ask the question, why don't you have more women and people of color in this class? That diversity would be so rich. So my response to them was, okay, Mr. CEO, how many of your direct reports are women or people of color? Silence. Okay, Mr. CFO or Mr. COO, how many of your peers are women or people of color? Silence. So my answer to them was, we can't up our representation in this class until you up your representation in your organization. And so that's a challenge, I would say, to you as well. So it's not just about the demographics of the people in the room, it's also about the institutions represented. We want certain kinds of institutions represented in this conversation. So my question to you is, for those of you who are running organizations, what does your workforce look like? So we can't broadly diversify the audience in this room until you broadly diversify your operations. Now, it does bring up a point, though. So yesterday I talked about, well, what if we, because the symposium sells out so quickly, and there are people who are waiting for it to come through their inbox so they can hit enter. And I said, well, maybe next year we'll do a lottery. So that's an option. If we wanted to deliberately to have a demographically representative group, we could curate that. That's a different way of looking at the participants. That may be something we want to consider. I don't know that we will, but that's certainly an option. We could curate and send out invitations for the symposium rather than a registration. So all of those things are things that we need to consider and look at as we continue to examine ourselves and examine how we're contributing to the issues. And we're going to hear this morning also from Susan Batten-Taylor, who runs ABFE, which is the Association for Black Foundation Executives. And so in all transparency, the foundation is a member of ABFE, and I am a board member of ABFE. But one of the things that ABFE looks at is across philanthropy, the underrepresentation of funding to organizations that are minority-led, minority-serving, minority-governed. So we've got to investigate and think are we guilty of that? How much are we guilty of that? What do we need to do better or more of or less of in that arena? And so then one of the other things I wanted to share with you, I want to share a story, then I want to tell you how all of this is shaping the foundation. So I heard just kind of in passing yesterday, several people talking about, is this a relevant, part of this notion of is race a relevant conversation today because of the generations coming after us have a very different perspective on race. And the generations coming after us have very race neutral, don't see color, don't see race. I'm not sure I can buy that completely just yet. So I'll tell you a story about my son who would be mortified if he knew I was telling you this, so please do not tell William I told you the story. But he was in the 4th grade. I think he was in the 4th grade, and my mother had come up for the weekend, and my husband and I were going out of town for a football game. Just as we're checking into the hotel, I get a call from the school. So every parent knows when you see the school's calling, like your blood pressure goes up immediately. So I answer the phone, and the principal says, first of all, William's fine, but we had a little incident today where another student called William the N-word. I said, okay, let me speak to William. So William gets on the phone. So William, are you okay? Yes, Mom. I don't even know why they called you. I said, well, are you all right with all this? He says, Mom, it's not the first time he's called me that. And I said, why haven't you said anything to me and Daddy yet? So my son's response was so amazing, I memorized it. So why haven't you told me and Daddy about that? For one, he's just a jerk, Mom. And you keep telling me as a black person I have to develop some jerk tolerance. For two, he's clearly got some problems. And you keep telling me just because somebody else has a problem doesn't mean I have to make it my problem. For three, I knew I'd have to have this annoying conversation with you. And for four, if I told you, I know you'd want to talk to his parents, and that would just be one more thing you did that I have to live with the consequences. I was like, check, 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 check. I was like, put the teacher back on the phone. Principal gets back on the phone. I said, he's fine. What are you going to do about it? So we conclude the conversation. So when I got home, I went to William and I said, you were pretty right on about everything you said, except you were wrong about one particular thing this time. I didn't call that young man's parents. As it turns out, William hadn't told the teacher about it. Another student had overheard the incident and told the teacher. So I called that young lady's parents. And I said, I know as parents we wonder if anything we're saying is getting through, if anything we're trying to teach them is taking. I just want you to know it is getting through. You should be proud of your daughter. This is what she did. So I called her. But that was one of those aha moments. It's like, do I have to go through this? Do I really have to do this with my son? Do I really? So I'm not quite convinced yet that we can call victory on this for future generations, that it's only us that needs the work. So that's, and again, please don't tell William, he'll be mortified. So, but how is all of this conversation and everything that we're hearing, everything that we're learning, how is it changing us at the foundation? So one of the biggest ways is that, as the speakers talked about yesterday, and as I'm sure some will talk about today, and as Chief Mullen talked about last night, we have to pay attention to the lived experience of the people whom we want to be in service for. We have to understand from them, not just from you, who are leading organizations. We have to hear from them directly, and from every corner of the continuum of accounting. As an example, in North Carolina, we had an education initiative we were about to start, so we wanted to hear from different communities. So we went to all communities across the spectrum. You know, we stopped people in the driveway, in the drive-through at Bojangles. We went to the tiendas. We went to the grocery stores. We went to the bridge clubs. We went to laundromats, and we asked people, so, you know, what's in the way of your child what's in the way of your child getting their best education? So in the affluent communities, we heard we need more AP classes, and we need more sections of AP classes. All the way down to, in some of the poor neighborhoods, we need our kids not to be subjected to gang recruitment on the bus. So again, we were trying to bring education within reach, you know, to use this phrase, that wasn't what we called it. And so, okay, so we said for the affluent folks, the education's in reach for you. You can advocate for yourselves. We don't disagree that you need, and your students need more AP classes, but that's not where we're going to focus. We've got to do the same thing when it comes to health and communities. What are the communities for whom health is not in reach? What does that look like? And they're not monolith. They're not monolith in an urban community. They're not monolith in a rural community. So we've got to understand what the lived experience is and have it influence and shape how we approach our grant making, how we approach our policies, how our policy agenda, how we approach our capacity building agenda. We also have to create a broader network of folks that we want to work with, of folks to engage with and partner with and listen to, particularly the business community across Colorado. So one of the steps we've made is we have joined every chamber of commerce in the state of Colorado. That's about 350. We joined 350 chamber of commerces. Because as our staff and all of us are out in communities, we want to be able to talk to the business community. We want to say, we want to support your efforts to make this a vibrant community. Because if you have a vibrant community with jobs, with a good education system, with a good health system, you're going to have a healthier community. We would love to have every chamber of commerce in this state have health as one of their foci. And what can we do to help them move that agenda? We're also being much more deliberate about seeking out grassroots organizations, people who are native, who are on the ground, who may go unnoticed, who may have gone unnoticed to us in the past. We're looking for them. And we want to be and work with them because they know their communities. They know how to guide us in the communities. They can vouch for us because we're still outsiders. We're still strangers. And so we're looking for that relationship. And we know with a lot of small organizations, we may not be able to go straight to grant making. We may have to start with capacity building. What do you need to be your most effective at the work you're doing? And we are committed to doing that. The other thing we want to do that I think the symposium is evidence of, that we want to challenge not only ourselves, but challenge those of you who we already consider kindred spirits. We need to challenge our thinking. Have we gotten into a rut? Have we gotten into a velvet rut? That we are so just kind of on autopilot that we forget to stop and ask ourselves, are we still relevant? Are we still addressing the current needs? Are we really doing this for the right reasons? Are we really doing this with and for the people that we care about and that we serve? So we want to challenge ourselves, and we hope you will hold us accountable to challenging ourselves. And we will work with you to hold you accountable and hold each other accountable for that. And I think the last thing that's not a change for the foundation, but it's just more of a magnification, got to be explicit, that we don't see the people in these communities, low-income, marginalized communities, we don't see them as liabilities in the community to be fixed. We see them as assets. We see them as assets to be mined, and that some of the most resourceful, smart, wise people you will ever meet are people who have to figure out every day how to rub 2 nickels together and get 50 cents. And we have to respect that they have an expertise that we could never have, and we hope we never have to develop. I hope I never have to learn how to be that resilient and that resourceful. But they have learned, and they've learned how to do it well, and still somehow get out of bed every morning and go to work and do the best they can for their kids. So we are really being shaped and influenced and changed at a very human and humane level about how we look at our work. Every dollar that we invest has a person on it. I mean, not George Washington, that person, but there's a person that's going to benefit. And we have to keep remembering that it's not the institution that got the money who is the client. It's the person who's the ultimate beneficiary. It's who the client is and who we care about and who we want to have them say that their lives are changed. Not just because of what we can do, because we can't do it all. We think we can contribute. We hope that we can make meaningful contribution, but it can't be something we do alone. But it certainly can't be something we do in isolation and in thinking that we already have the answer. So with that, we have a day ahead of us that is, again, another provocative day, a day about thinking about what can we as individuals and what can we institutionally do? How do we continue to challenge our thinking about inequity and equity? How are we and our organizations positioned to either enhance, destroy, or are we part of the problem? So I'm going to start with introducing our first speakers, who are from the National Equity Project. First, Kathleen Osta, who's the Midwest Regional Director for the National Equity Project. She's participated in the development of the Coaching for Equity methodology, which I hope we'll hear about today. She's designed and led professional learning and was responsible for the organization's program development and operational management. She's formerly a social worker in the Chicago Public Schools and was a bilingual kindergarten teacher. Then her colleague Hugh Vasquez is a senior associate at the National Equity Project, where he develops and expands their leadership for equity work. He's worked with hundreds of organizations and thousands of individuals to address race, gender, class, and other social divisions. So please welcome Kathleen and Hugh.
Hello. Good morning. It's not a rhetorical thing right there. Good morning. So I learned something new today. One is that there's something in front of us called a confidence monitor. I need one in my office. I am going to introduce myself a bit, and Kathleen will, and we're going to just dig right into this phenomenon called implicit bias. But I want to start by saying that I am here with ancestors and relatives who paved the way for me to be here. I think most of us are, all of us are. In my case, my Mexican grandfather was a revolutionary, and I kind of am proud to be in his footsteps. He actually, at the age of 14, left his home in Mexico and joined Pancho Villa to fight in the revolution. I used to think that was a unique thing until every other Mexican I met said the same thing. Which is probably true, that most of our relatives fought with Pancho Villa if we're in this country now. So I am here because of him and because of many others who came before me, and I'm proud to be standing up here with this. We are going to be focusing on implicit bias. It is one of the most hopeful learnings that has come along in a long time. Hopeful for me in the sense that it has given us some understanding about how race and racism and other isms perpetuate, are produced, maintain themselves through something called implicit bias. It's not something that we understood a long time ago. It's a fairly new understanding. And it's giving hope because it's given us a deeper way to understand what we can do about it. But that in itself, just looking at implicit bias is not sufficient, because we know that we sit in a system that is one made up of oppression. We are in an oppressive system. So if we focus on implicit bias just for understanding our individual selves, things will not change. We have to see it in the context of systemic oppression. And in that sense, understanding implicit bias is in service of changing, transforming our systems around us. And so that is one of the whys why are we doing this? It's so that we can transform our systems, not just for the individual changes that we need to go through.
So I'm Kathleen Osta, and I've been working for and with the National Equity Project for 20 years. First out of our Oakland office, and for the last 4 years based in Chicago. My father moved to Chicago in 1964 to work as a community organizer on the west side of the city, organizing to fight against housing discrimination. And I grew up in a town called Oak Park, which is just west of the city. I lived 2 blocks west of Austin Boulevard. And if anyone knows Chicago, Austin Boulevard is the dividing line between the city and the town of Oak Park. So from my house, I could see the west side of Chicago. And what I could see were vacant lots and schools with broken windows and lots of liquor stores. And I lived in Oak Park, 2 blocks, literally from here to the door in the back of the room. And where I lived, our schools were well funded. We had lots of green space and lots of resources, what we call a high opportunity neighborhood. So I grew up with a lot of consciousness about these 2 worlds. And I also had the sense from a young age that something wasn't right. And I didn't have any language for understanding what that was about, but I knew something wasn't right, and I have spent the last 25 years in my career working for social and racial justice. And yet, when I, about a month ago, went out for a run in my neighborhood, I was running along and I saw a Latina woman walking out of a large brick home. And in an instant, I heard the word house cleaner in my brain. I caught it, and then as I approached and got closer to the house, I realized this woman was absolutely not a housekeeper. She was the homeowner, and she was leaving her home probably for work. Now, my conscious mind knows that Latina women are bankers and doctors and social workers and professors, but my unconscious mind worked more quickly than my conscious mind. And because of the systems that we live in and the ways that the messages that we inhale about people and the people, who people are, my unconscious mind had produced the word house cleaner. So I passed the house and I reflected about how outrageous that is. And here I am, going all different places in the country talking about implicit bias, and I'm going for a run in my own neighborhood and making the assumption that a woman coming out of a house, a Latina woman, couldn't be the homeowner, she's a house cleaner. So that's why it's important that we talk about this, because this is not about our conscious values or our explicit values. This is about what happens in all of our brains. And so the exciting part is we're learning about our brains, and we're learning there are things we can do about it, and that we can actually catch that happening and mitigate against the negative outcomes that can happen when we hold those unconscious biases.
So we want to take off from Kathleen's story. And our work with you this morning for the brief time that we have is to get you engaged and involved in making the invisible visible by looking at our unconscious. And we're going to do this in a couple of ways. One is we're going to do a brief orientation about a few facts about how our brains work, because we want to know what we've learned about our brains so that we can actually understand, how do I go backwards? Understand how our brains are functioning. So here's the iceberg, and we use this metaphor because, as David Brooks puts it, that our unconscious parts of the mind are most of the mind, where most of the decisions and many of the impressive acts of thinking take place. So you notice what's below the waterline with an iceberg. Everybody sees that, right? Most of the iceberg is where? Above or below? It's below. And what we see above is only a tiny part of the iceberg, while our brains and our minds and our unconscious mind is like that. We are looking at what is below the waterline when we're looking at our unconscious mind. Here's a couple of facts about our brain. Our brains process 11 million pieces of information a second. Now think about that for a moment. 11 million bits or pieces of information a second is processed by our brain. Now I know who's out there saying, well, how did they count that? Right? 11 million pieces of information a second. And only 40 to 50 of those pieces of information are conscious. So what does that mean? We're walking around largely unconscious, is what that means. That's exactly what that means. Our unconscious is working faster and in greater depth than our conscious mind. Here are a couple other facts we want you to know, processes about how our brains work. Our brains are meaning-making machines. That's what they're designed to do, to notice what's going on around us, to recognize patterns, to look at what is happening around us so quickly that we make meaning of it. We take in data, it sorts the data, makes meaning of the data, and it's traveling at the speed of light. Very quickly, our unconscious mind is traveling at the speed of light. Our conscious mind is, like we say, taking a slow walk. Our conscious mind is not really recognizing what is going on as quickly as our unconscious mind is. And it's a good thing that it does that, our unconscious is working, because our unconscious mind is what is protecting us. It helps us to survive. The fight, flight, or freeze response is coming from our unconscious mind. If I am walking down the trail, especially in older times, historic times, I'm walking down the trail and I hear some rustling in the bushes going on, and I depend on my conscious mind to go, well, I wonder what that is. Yeah, I've heard that before. Yeah, well, it might be, bam, I'm gone. If I'm counting on my conscious mind. Because that bear, that wolf, or that whatever is going to get me. If I'm counting on my conscious mind. Instead, I rely on my unconscious to recognize the patterns more quickly than my conscious mind, and it helps me to do fight, flight, or freeze. So we want our conscious mind to be working with us. That's how we have made it this far, is because of our unconscious mind. So we want to take a look at how our brains operate. We form these patterns, and we form these patterns so that we can actually take shortcuts so that we don't have to think everything through consciously before we do them. So we're going to ask you to participate in an activity, an exercise, that helps us all to take a look at how our brains work. And all you have to do is to state the color of the text when you see it. But we're doing this as a group, and we're doing it aloud. So you're not doing it silently. You understand that part, right? So when you see the text, holler out the color of the text all at once. Are you ready? Let's go.
Blue, red, green, black, green, red, blue, black, green, red, blue, black.
What happened? What happened? Now, this is not an IQ test. It's not to measure your ability. This is showing how our brains process. Now, what happened when the color matched the word? You were able to say it quickly. Is that true? What happened when the color did not match the word? You hesitated. Is that right? It was a hesitation. Why is that? Because our brains have been conditioned to match color and word quickly when we see it, but we haven't had as much practice doing it the other way, when the word and the color is different. Fair to say? Got that? That's how our brains are working. It's not that you are any better or worse as a person from having done it like that. It's because our brains operate that way. We form patterns. Our brains make sense of those, and it's our unconscious mind that is making the sense of those. So guess what? We're going to do it again. You ready? Let's see what happens this time.
Blue, red, green, black, green, black, red, green, red, blue, black, green, red, blue, black.
Aha, what happened that time? Proud of yourself? So this is a demonstration that shows how quickly our brains can adapt. What happened in the second time around, even though it was only the second time around, is that you formed synapses already. Synapses that allowed you to do something faster and quicker that you didn't do the first time. The synapse, by the way, if I can get this to work here, the synapse is that bright spot right in the middle there. And this is not a reproductive talk, so this is a picture of a brain synapse going on. But the synapse, when it fires, it forms all those little tentacles out there that produces our ability to do something faster and faster and faster and faster. The first firing has only one, but after hundreds or millions of firings, it produces a lot more, and we can do it faster. You produced a synapse that second time around that allowed you to state the color different than the word faster the second time.
All right, so now we're going to talk about implicit bias, and we're going to talk about 3 processes that produce implicit bias. We're going to take one at a time. So one is called priming, the next is associations, and the third is assumptions. So to get started, we're going to take a look at a video.
The answer is 13. But did you see the moonwalking bear?
All right. Raise your hand if you had the answer right, the number of passes, that you had 13. All right? Raise your hand if you did not see the moonwalking bear. All right. So what's at play there? You were primed by the narrator to count the number of passes. That's called priming. You weren't primed to look for a moonwalking bear. So your brain was focused, its attention, where you were primed to focus it. So let's make a connection now to implicit bias and actually provide a definition. Implicit bias is the process of associating stereotypes and attitudes toward categories of people without conscious awareness. Okay, so that's the key, and we all do this. That's the piece about this work that can be challenging but is also hopeful. We have to start by acknowledging that we all do this, and then we can do something about it. But the effect of that those unconscious biases that we all hold can result in us taking actions and making decisions that are at odds with our values without even being aware of it.
So here's an example. I want you to think about Kathleen's prime of what's at play here. A number of years ago, I was directing a youth program, and the youth program was one that took 120 teenagers away for a 7-day residential program. I know that sounds crazy now, and I was younger then, to focus on issues of racism, sexism, heterosexism, anti-Semitism, and classism. So we were training very deeply as adults, how can we work with young people on these issues if we don't do our own work? And so we did our own work, intensely looking at ourselves, our own awareness, our own consciousness, our own racism and sexism and so on, in order to be able to work with the young people. On one summer afternoon, this is in Oakland, California, I was driving to lunch, very warm outside, and I had my windows down in my car, and my car was the first car at this one signal light. So I was right at the crosswalk line. It happened to be by a school, a middle school, and there were kids crossing. And over to my right were 3 young African-American boys that started crossing the crosswalk in front of my car. And as they approached, I looked at them and they looked at me, and one of them said, "Go ahead, roll up your window and lock the door." And then he kept on walking by. Now my response in the moment, instantly, was, who do you think you, no. Do you know what I do for a living? Do you know that I'm here on your behalf every day? Or, do you know that, that was my instant response. I was not in my best facilitative mode at that moment as they were walking across. And the 3 of them just kind of looked through the window at me as they were passing, and I was glaring at them, like that. And as they passed and got further, I started to relax a little bit, and I noticed then my hand had moved to the switch. I didn't know it until they had passed. They didn't see my hand as they were looking in the car, but they knew what I was going to do, or at least one of them knew what I was going to do. So the question is, what happened inside my brain that my conscious awareness was not the same as my unconscious? My unconscious moved my hand to the switch. Why is that?
So what's at play there? Hugh's unconscious mind perceived threat, danger, black boys coming across the street. Without even thinking, his hand goes to the switch. Meanwhile, you heard the work he's doing, right? So again, there's very little correlation, studies have shown, between our conscious values and unconscious bias. So what's at play? We're primed over and over again in our society, in the media, in the messages we receive about who people are, That priming leads us to make associations in our brain, right? Literally neural pathways in our brain. And those associations lead us to make assumptions about categories of people unconsciously. What's at play here? What are the messages of these billboards? Call it out if you would. What's the message here? Sex, what else? Latin lovers. Say it again. Alcohol. All right. Stereotypes about Latinas and Latinos. Sexualizing Latinos and Latinas, objectifying them. Now, we may drive by signs like this or see this in magazines and not have any consciousness of that subtext. We may or may not, but the fact of the matter is we're absorbing those messages. And we know that people of color and women are portrayed in negative and dehumanizing ways in the media at a much higher rate. And the messages underneath that portrayal, whether it's explicit or not, are that people of color are involved in crime. If you turn on your local news, which I don't do for this reason, and I don't turn it on with my children around, is because all you see, right, are images of people of color committing crimes. They're poor, they're on drugs, they're lazy. There's all these implicit and explicit messages in the news media and in social media and television that our brains are absorbing, whether we choose to absorb it or not. So the messaging is happening, whether it's conscious or not, and those are producing associations. So this is a pool safety public service announcement that came out from the Red Cross last summer. What do you notice? Who's cool?
Look at that.
White kids? Yeah. Apparently the white kids are cool at the pool. Who's not cool? Every single brown kid. Brown kids apparently push kids into the pool, right? They run. You're not supposed to run at the pool. And it's only the brown kids who do that. Now, how do you think that happened? How did that go out from the American Red Cross last summer? Was it conscious? Maybe, maybe not. But how many people reviewed that before it went to national publication and weren't conscious of what they were looking at and sent it on? And then how many young people looked at it, and whether they were conscious or not, what did they absorb from that message? Now, the Red Cross took that down almost immediately. That was, I don't know if some of you may have seen it, but it got called out very quickly and taken down. But the fact is that happens, and it happens at an unconscious level if we're not super vigilant about the negative messages that we have absorbed. So we're primed, and racial stereotypes are reinforced as a result also of the structural arrangements that we talked about yesterday and that we heard about a fair amount from our speakers yesterday, that we have an unnatural set of conditions in our communities where we have neighborhoods that have experienced decades of disinvestment and neighborhoods that have been, that we call high opportunity neighborhoods where investment has flowed in. And what happens then, the way that those unnatural structural arrangements reinforce the negative stereotypes is that if you can imagine young people going to school in the top picture, they are likely going to a school that's underfunded. They are probably have teachers who are not as experienced. They don't have as many materials. The school may not be as welcoming to their parents. They may not have any green space. And then when the kids don't perform, if we don't have a structural analysis, our unconscious mind can say, something's wrong with those kids. All those kids over there in those schools, they don't act right, and they're not performing for not consciously catching that. Likewise, we can think that kids who live in neighborhoods like the one in the bottom are somehow, they actually are just smarter or more committed to school. So the structural arrangements of our communities and the historic racism reinforces the implicit bias.
So we want to give a couple more examples of associations and how associations are powerful for for contributing to what happens with implicit bias. So this is a media image after Katrina, Hurricane Katrina hit through. And in case you can't see it or see it clearly, the top photo is an African-American person, and the bottom are white residents. And here's what happened with the headlines from the news, what you see in the news magazines here. They said this. They didn't put the ethnicity. We added that for emphasis. A young black man walks through chest-deep floodwater after looting a grocery store in New Orleans. That's connected to the top image. The bottom one was this. 2 white residents wade through chest-deep water after finding bread and soda from a local grocery store after Hurricane Katrina. Now, these were in the same publication at the same time, just like this, except they didn't have the words black or the words white residents. So how are we primed? How are we making associations? How is the media influencing that? That's an example. There are other examples of associations that we make. So we make associations about certain people. Look at the associations here. What associations do you make of these two? Right? So the associations are powerful for us. And if we want to make the associations, we have to make the associations visible in order for us to do something about them. So we know that implicit bias connected to that, it kicks in before we are aware of it. Our examples are examples of implicit bias kicking in before we are aware of it. And it happens through the building of those synapses. Remember that picture of the synapse. Over and over and over again, I am fed, you are fed, our brains are fed, the images that produce the synapses, the messages that produce the synapses that then produce the behavior, and it results on some autopilot, like my finger going to the switch, but it also produces some autopilot that is life-threatening. When we see what happens in some cases with law enforcement in some of our communities, there's autopilot that is going on there, right? So we want to notice that when we see who gets sent to the office for discipline in schools, there's autopilot going on there. That's part of our unconscious awareness that stems from some of the associations that we have made. So we know that the mind is doing this coding, and our unconscious is doing the decision making. Right? Just like we talked about walking through the trail, our unconscious is doing the decision making, largely invisible to us. And our goal is to make it visible. So one of the ways that has happened is that this is an example a number of years ago. I think it started with the Philadelphia Philharmonic, where the community said, we do not understand why the orchestra is all men. And at that time, the orchestra was all men. And the answer from the leaders in the orchestra were, well, we do auditions and we just can't find any qualified women musicians. So someone had the idea that what we ought to do is do auditions behind a screen and see what happens. So they did auditions behind a screen. And in the first round of doing that, they noticed that things didn't change, that they still had more men, almost all men were selected for the orchestra and no women. And then somebody realized that when they were doing the auditions behind the screen, they were doing it on a stage with a wooden platform, with a wooden floor. And guess what? The women had to walk across that, everybody did, in order to sit down and do auditions. Well, guess what they heard? The shoes. So they put a carpet down and did the auditions again. And within one round, the orchestra went from 0% women to 50% women in one round.
Okay.
What's at play there? Implicit bias was deeply associated to what was going on, right? Do this one.
So again, with the brain, there have been studies done that have shown that people have greater empathy for people in what is perceived as the in group than the out group. And they have done fMRIs of the brain that have shown that when people are shown images of a white hand and a needle being put into that white hand, the parts of the brain that indicate empathy light up. When they're shown a picture of a black hand and a needle is put in, the parts of the brain don't light up as much. And that's true even for African American people looking at the image. So what that is reflecting and what has been shown in study after study is that there is a pro-white bias that we all have absorbed unconsciously. It's not that we're walking around consciously feeling or stating that, but unconsciously that has happened. And some of you may be familiar with the implicit association test. And that test, when done over and over again, has shown there is a negative black bias and a pro-white bias that lives in our brains. And we have to confront that because there are things we can do about it. So a few of the ways that plays out, though, is that in Colorado, there was a study done of healthcare providers. And the study showed that there was very little explicit bias toward African American and Latino patients. People were really happy about that. However, there was a high level of implicit bias when they were tested using the implicit association test. So how does that play out? One of the biases that was found among physicians was that physicians had an implicit bias that African American patients were less likely to adhere to medical guidance and less likely to follow doctor's orders, so to speak. And so how did that play out? African Americans were less likely to get organ transplants, fewer full joint replacements. And again, this is not consciously happening, but the data showed that that was happening. Women with heart disease are less likely to receive angioplasty and twice as likely to die as men if they're having a heart attack. And we talked about that yesterday with the ambulances. Ambulances, for some reason, take longer to get women who are having a heart attack to the hospital than men. And it's not because they're taking a different road, right? What assumptions do we make about women and women's pain compared to men's pain? Right? Drama. Latinos receive less pain medication during cancer treatment and during childbirth. And African Americans with diabetes are more likely to be amputated than diabetic whites. So these are serious, serious outcomes of these implicit biases. All right, bad news. We can't avoid absorbing all these categories because we have a history. Our country has begun with systemic oppression and we live with systemic oppression. So we can't avoid taking in all the messages that permeate the media and television in our communities because our brains are naturally categorizing and meaning making. So that's the bad news. Here's the promising news. Biases are malleable. We can influence our unconscious bias. We can build new mental associations, new synapses. And we can work to become more conscious of how biases operate in us and how they show up then in our decision making. So this is Marion Diamond. She actually died just last week. She was a pioneering neuroscientist who was the first to show that the brain could change as an adult with experience in enrichment. She actually studied Einstein's brain and saw differences in his brain that were the result of enrichment and experience, and then did studies on rats that showed with different kinds of stimulation, the brain could change at all ages. As a woman, though, and this was in the 80s, when she presented her initial research, she was presenting to largely white men, scientists, and when she presented, there was a man who literally stood up and said, "Young lady, that brain cannot change." So the good news is she respectfully disagreed and carried on with her work at UC Berkeley and could actually be seen walking around campus with a brain. So Hugh asked me, why does she have that brain in her hand? I said, because she literally carried it around. She studied the brain and showed us that, and brought up to the fore the concept of plasticity, that our brains can change. Your brains have all changed right there when you did the color activity. And we can be conscious about what are those neural pathways that we want to build and be intentional about that with the idea that cells that fire together, wire together.
So we're going to close in a moment, but we want to go through a strategy that helps us look at one strategy for how we can change our brains. Now, you see strategy number 3 up here. It's not because we misnumbered it. This afternoon, we're going to be looking at 4, and this is the number 3 strategy. This is about creating new narratives. We're producing new synapses in our mind as we do this. So I want you to call out to yourself, call out aloud. What's the new narrative here with Latinos in schooling? Name it. Call it out quickly. New narrative. Say it. Because if you say it aloud,
Graduates.
you produce a synapse.
Latinos
by
graduate.
saying it aloud. What's the new narrative about these young people, young African Americans in school? Holler it out. The new narrative. You're creating a new pathway when you say it. What's the new narrative about these young people of color, these kids in school? Scientists, smart, engaged. What's the new narrative about these young African American kids? Studying, inspired readers.
Love to read.
Right? You're forming new pathways. What's the new narrative? This is like the word test and the colors. We have to be able to see the new narrative even here. What is it?
Potential.
Potential.
Graduate student.
Worked hard and taken a break. What else? Fashion forward. All right. Close it out.
All right. Closing quote here. And Dr. Banerjee worked on the implicit association test. Implicit biases come from culture. I think of them as the thumbprint of culture on our minds. Human beings have the ability to learn to associate two things together very quickly. That is innate. What we teach ourselves and what we choose to associate is up to us. Thank you.
Thank you. While we're waiting for them to put the podium back up, the first time I ever did that moonwalking gorilla thing, I swore up and down that they had doctored that video the second time, that it was not there the first time. I was focused on counting how many times those balls were passed. And then I think not the last, certainly not the last, but one of them, the kind of 2x4 up beside the head about my own implicit bias, we were looking for a hedge fund expert, a hedge fund manager to add to our investment committee. And so Ron told me we found someone, we interviewed someone, and it turns out, so he's a hedge fund manager. He also is a volunteer firefighter and an EMT, which blew my mind because my perception was, Michael Douglas in Wall Street, Bernie Madoff kind of thing. And then here's a hedge fund manager that is an EMT and a volunteer firefighter. So I realized I had my own biases around that, and it's like, wow, that was pretty obvious, Karen. So moving on, and one thing I forgot to mention earlier, please, as you have questions for any of the panelists, go ahead and write them down on the cards. For any of the speakers, write them on the cards, send them to the end, and then we will look through them and talk about some of them as we have the panel discussion. So next, Susan Taylor Batten, as I said earlier, is the president and CEO of ABFE, ABFE, which is the Association of Black Foundation Executives. Before joining ABFE, Susan was a senior associate with the Annie E. Casey Foundation, where she was helping communities and other partners transform neighborhoods into family supportive environments and working within the foundation to address racial disparities in grant making. Previously, Susan was vice president at the Center for Assessment and Policy Development. She worked at the U.S. Department of Agriculture, Food and Nutrition Service, where she oversaw national evaluations of federal child nutrition programs and helped to increase access to food programs for the homeless. She worked for the government in D.C. On comprehensive children's initiatives. She's the co-founder of the Race and Equity and Philanthropy Group. She's won many awards in that in that arena. And because this conversation is so important to her, Susan postponed her vacation trip to Jamaica, where she is buying a condo, a vacation condo, so she postponed her closing to be here. So thank you, Susan, and welcome, Susan.
Hello, how are you? Great, thank you so much. It's bright up here. Ooh, I didn't realize how bright. That was great. Thank you so much for that. Learned a lot. I am glad to be here. Thank you, Karen, for inviting me. It's good to be in Colorado. I'm going to use a podium. I have been on a whirlwind tour around the country. I just left Karen's great state of North Carolina, and I am actually off to the beach in a couple of weeks. So if I'm looking at you with big smiles, it's because you guys stand between me and Jamaica. So really good to see you guys. I'm standing behind a podium because the first thing I'm going to do is take my shoes off, right? You guys can still see me, right? Okay. Okay, the altitude is sort of getting to me. I realize that. And so the advice I got was drink a lot of water, but I can't drink a lot of water and get on stage. I just can't do that. So I'm going to use the podium sort of to hold on to. I am really pleased to be here. I'm going to jump right in because I'm going to give you a lot of content, but I'm really glad to follow my colleagues. And you all have had a number of great sessions, and I was thinking, what is it that I could possibly bring you that is new and different? And perhaps maybe some things would be a little new. But you know, I think it's important to say that working on issues of equity is lifelong work. It's lifelong work. We are all learning. It's a journey. It's a marathon, not a sprint. And so my hope is that with all of the sessions, including what I'm going to share with you this morning, you can just take bits and pieces from all of our comments and all of our ideas to help you advance what is critically important work, and I just want to thank you for that. So what I'm going to do is share with you three things this morning. First, I want to talk to you a little bit about ABFE, how we actually look at equity. And I should say that I'm going to focus mostly on racial equity, and I can talk a little bit about that through the conversation as to pick up actually on some of the points that Karen made about why we think coming through the door of race ultimately gets you to gender, sexual orientation, and the like. So I'm going to focus mostly on racial equity. The second is that I just want to share sort of some basic concepts and definitions. I have to say, we do foundation, board, and staff training around racism and racial equity, and I think we always make the wrong assumption that people have a shared language and set of definitions around words like equity, for crying out loud, or race or racism. And I find that's a lot of what people stumble over when they're trying to have what is already a hard conversation, is just, are we in the same discussion? So I want to talk a little bit about definitions. And then third, talk a little bit about what's going on in philanthropy, because that is the work that we do at ABFE, and then point you to a few tools that may be helpful in your work that we're promoting at ABFE and sort of trying to get through the foundation sector. So I'm going to do all of that at a very high level because I have 30 minutes. Just 2 points of context. My colleagues really just helped us understand implicit bias, but did say that it's important to think about a broader frame around addressing racial equity. I'm going to be talking more about structural racism and institutional racism, but I think you'll see the importance of understanding implicit bias and then what gives it power are policies and practices that are put in place that advantage some groups and disadvantage others. And then the other, I just want to give real credit to the Annie Casey Foundation. As Karen said, before I came to ABFE, I was a senior associate at Annie Casey and helped develop something called Race Matters. So much of what we use at ABFE really came from the work that I was privileged to do at the Annie Casey Foundation, a group that is still working hard on these issues because nobody's got it right. That's the one thing we have to remember. We're all still working hard at this. So To get us going, just to talk a little bit about how we look at racial equity. And often what we are doing at ABFE is helping people make the case about why it's important to focus on racial equity, whether or not you're doing health work, whether or not you're doing education work. And actually, we put together these points because, as mentioned before, folks typically will want to talk about anything else but race, right? Folks would rather talk about class. Folks would rather talk about place. And one of the more challenging conversations is, again, to talk about race. So we put together a set of starting assumptions that actually are meant to be talking points for many of our colleagues to use in their institutions. And the first is, and actually Karen queued me up, that race matters because it doesn't matter what work you're doing. Again, if it's education, if it's child welfare, if it's, you name it, justice, we see disparities based on race. Every indicator of well-being in all of the issues that we work on in the field of philanthropy that you all may be working on, we see disparities based on race. And yes, class matters too, because ultimately folks want to go straight to class. It's not race, it's class. Class matters too. All foundations that we work with at ABFE are critically concerned about reducing poverty, and we should be. But it's important to say that even when we control for class, on many indicators, we still see disparities based on race. So it's not either or, it's definitely both and we can't let race fall off the table. Clearly, place matters. There's a surgence in the field of philanthropy, probably over the last several years, about place-based initiatives, and that's critically important. Folks will focus on the south side of Chicago or east of the Anacostia River, often without talking about actually who lives there, right, which are predominantly people of color. And we know we live in a highly segregated country, and, but places are racialized. So it's, again, not that we're saying place doesn't matter, but we have to be very clear that places are racialized, right? We're in a highly segregated country. And then finally, we often hear from folks that it's not about race or class, it's really about personal responsibility. And we say, yes, that matters too, right? It's clearly a parent's job to raise their child. But we know certain parents or some parents have access to opportunity, live in places that are deemed high opportunity neighborhoods. And choices that parents make have a lot to do with the experiences and the options they have to raise their kids. So when we talk about racial equity and we talk about focusing in on race and going through the door of race, we're not trying to say that none of these other things matter, but that clearly, and we've seen it over and over again, many of these other issues, race will fall off the table, quite frankly, faster than many of these other issues will. So we actually give folks those talking points to talk about why we need to sort of focus on all of it. A few other starting assumptions in terms of making the case and the case building for racial equity. Disparities are often created and maintained through policies and practices that contain barriers to opportunity for people of color. And again, taking into consideration what we now understand about implicit bias, these are policies that are developed by human beings, right, that aren't necessarily primed for or looking at how certain policies might impact folks of different racial ethnic groups. So our work at ABFE, though, really focuses on looking at the role of policies in this country and how they disadvantage communities of color and perhaps advantage white communities. The second point really lifts up this notion of intentionality, and I love that I followed behind you guys. You have to look for it. You have to look for it because we're primed not to look at the impact of policies and practice on race. So if we want to close health racial equity gaps, if we want to close educational gaps around race or between communities of color and white colleagues, we have to talk about it, right? And we have to be intentional. I've got some tools that we'll share with you that helps us be intentional. And then this last point really is the point of optimism. I actually have that as well because we have seen over and over again that there are more folks out there than we think that are interested and concerned about addressing issues of equity, but they need support, they need information, they need knowledge and skills and tools. So I actually think we're in a place where we have folks that want to do this work, but just need to be supported in a good way to do it. So in addition to what we say to foundations when we're working with them is that not only do you need shared language, and I'll get to some points around definition and the like, to have a productive conversation about racial equity, you also have to have a shared point of view, right? And there are many perspectives and points of view out there, but this is a little bit about how we think about it at ABFE, and it's one that is evidence-based and has a lot of research behind it. And that is that this country has historical patterns of policies and practices and media messages and images to bolster them. We just saw some of that, right? That result in the exclusion, marginalization, and control of black people. And I say black people because of who we are, but you could substitute people of color there. I'm just talking about who we are at ABFE. And these persist sometimes in new forms up to today. And again, when you look across sort of sectors or issue areas, we can come up with, if I asked you guys to shout out some, you probably could as well, but we could come up with, again, policies and practices that disadvantage communities of color. Right, so when you look in the area of education, there are many to think about. I'll just lift up two. One, school discipline policies that disproportionately impact students of color, that lead to disproportionate push out of students of color. Again, a lot of this has to do with what we're ingrained in thinking and believing about different students, and then putting policies in place that actually disadvantage students of color. Another might be school funding formulas in this country that still distribute school district funds based on home values. Right? And knowing that housing values in communities of color are worth less. And we still have a number of school districts around this country that distribute their district funds based on home ownership values. And that's how you get to the schools that have less money, they're underfunded, less prepared teachers and the like. So I'm sure there are more in the area of education. In the area of workplace, I just left a conversation with one foundation that was looking for, they were hiring, and they were looking for a new director of their national child advocacy and policy portfolio. And one of the criterion for the job was that the person had to have run a statewide child advocacy and policy portfolio. Well, if you take a cursory look across the country as to who's running statewide child advocacy and policy organizations, it's not diverse at all. So just that one policy actually sort of discredited or sort of screened out a number of people. But there are, again, multiple. I just went down to a very specific foundation, one particular workplace, but there are multiple sort of policies and practices that we can think about in terms of workplace that disadvantage communities of color and have over time. In the area of public systems, in the area of justice, many of you may know about the different sentencing policies for crack versus powder, cocaine, all right? Crack being a cheaper version of the drug, actually more sort of used in poorer communities that are disproportionately communities of color, but yet have harsher sentencing policies than crack, right, in the powder form that's used in sort of more well-off neighborhoods. So there are a number of examples, again, of policies and practices historically and up to today, I didn't go all the way back, up to today, actually that disadvantage communities of color. And then finally in media, and our colleagues before me actually just talked a little bit about sort of images that we see and why we've got to know that this is ingrained, right, in us, in our head, and that's people of color and white colleagues. And so when people say they don't see color, it's actually not humanly possible not to see color given the society that we live in. So just a few points about media portrayal. The 4 points on that one side are basically what research shows about, as our colleagues mentioned, about how people of color are portrayed in the media. And the 2 points above the picture actually are really the devastating impacts. Just 2 points here, devastating impacts of media portrayal. And I loved your pictures. I pulled this one with LeBron James, and I think her name is Giselle, who is an international model, and how close it looks to the picture on the other side, which is, what's his name? King Kong. Yeah, King Kong. So I want to skip a few. Let me go this. We're talking about health, right? So how many of you all out there have heard about David Williams from out of Yale University? Oh my gosh, check him out. One colleague, check him out. I just heard him speak. I did not know about his work. He has a TED Talk. And if you can, check out his TED Talk. His name is David Williams. He created something called the Everyday Discrimination Scale. And that scale has been used to collect research on people of different races that have experienced things like being treated with less courtesy, receiving poor service, right? Being treated like you're not smart. People act afraid of you. These very small, sort of subtle sort of forms of discrimination that some people call microaggressions, right? Everyday sort of small, subtle forms of racism. Tanae Lewis, who is out of Emory University, actually has used the scale and has begun to organize research that shows how everyday discrimination actually shows up in health outcomes, right, for people of color. So I really encourage you to go deeper, to look at Dr. Williams' work, check out his TED Talk. There's another actual documentary that is great. Hopefully you've heard of it. It's called Is Racism Making Us Sick? That was produced by California Newsreel that does a lot of this as well, helps us associate sort of the impact of discrimination on health outcomes. So I want to move from case making and just a few sort of comments about definitions, because I think, again, it's important that as we sort of get into this work around equity, we really use all the opportunities we have to build our competencies, really, around race and racism. And we use this sort of this wheel, or cogs in a wheel, actually, to help folks understand different forms of racism. And it's important, if we're talking about equity and health equity, to understand these concepts, because the strategies for addressing them are actually very different, right? So if I start with personally mediated racism, this is basically personal prejudice, personal bias. This is where the implicit bias sort of fits in our sort of scheme, because personally mediated racism can be implicit, could be explicit, could be conscious, could be unconscious. And if I move to institutional and structural, this is more about the policies and practices of institutions, actually, that, again, disadvantage some communities and advantage others. There's internalized racism. This is the most harmful, I believe, of all, when the stigmatized group basically drinks the Kool-Aid and believes they are less than or not worthy. And then there's white privilege, right? A set of privileges that come along with whiteness. Many of you may know of Peggy McIntosh's work called, it's about a knapsack. I can't remember the name of it, Unpacking the Privilege Knapsack. And she talks about sort of white privilege, and I also have to read these because these things aren't familiar to me, but I actually best define it as examples, and she gives a few. When you see people of your race widely represented on TV or media. 2, you can be assured that your children will be given curriculum materials that testify to their existence or race. 3, when you don't have to worry about being asked to speak for all people in your race. And 4, if a cop pulls you over, you can be sure it's not because of your race. She's got some really helpful ways to understand privilege. So just in summary, I as we go through the sessions this afternoon, be thinking about these different forms of racism and how, in fact, they can be addressed when you're thinking about health equity and health outcomes. And the last definition, actually, I'll use is one on racial equity in particular, and I think this can be used interchangeably, quite frankly, with gender equity, you name it. And we say it's both doable and measurable. This is actually some data, and the data points actually don't matter. I know you can't see this too well, from an NEKC Foundation body of work in Portland, Oregon, looking at the the numbers of juvenile lockup, actually. And the attempt was to actually reduce the number of kids that were being sent to prison. And on your right-hand side was actually using a racial equity frame. The left-hand side was actually using some very explicit tools in Portland, Oregon, to actually reduce the number of kids going to lockup or to more adult prisons, quite frankly. And what you see is when we talk about racial equity, we're talking about making outcomes better for everybody, right? So the numbers come down for everybody while simultaneously closing the gap between actually the right-hand side, the orange are Latino kids, and the white, and the left side is white children. So we want to make the world better for everybody, but simultaneously reduce the gap. So our definition is almost like a set of results we're seeking for. Racial equity is achieved when you can't predict advantage and disadvantage by race, right? I could say the same thing about gender equity is achieved when you can't predict advantage or disadvantage by race. You can't look at a chart like we all can do today, right? If we're looking at outcomes, be it graduation, you name it, and know those are the black kids, those are the Latino kids, those are the white kids, right? When we can't predict advantage or disadvantage. Just a very quick, again, in the spirit of learning, that there are many ways to work on equity, health equity, racial equity. Our focus at ABFE is on structural racism in particular, but I raise this because I think we all need to get competent and stronger on different strategies. There's a really good resource by a woman by the name of Alana Shapiro. It's called Training for Racial Equity. It's actually kind of old, but it was very helpful to me years ago. That actually goes through different approaches to work on equity and also gives you the name of consultants and organizations that can help train up your organizations, your foundations, and the like on these issues. But you see prejudice reduction, healing and reconciliation, which is sort of what happened in South Africa, actually happening in many communities in the South, that suggests that we can't heal and move on until we recognize past acts of wrongdoing, like, when that cop shot that black kid 10 years ago and nobody talked about it. We have to talk about that so we can heal and move on. There's diversity and multiculturalism, democracy building, and civic engagement. Again, all of these are ways in which we can get smarter and stronger on issues of equity. So I am going to close with a few points about philanthropy and a couple of tools. So, we're working in a sector where we've got some steep hills to climb, but I don't think it's, quite frankly, much different for philanthropy as a sector than other sectors in this country. One is that many of you may know, that foundation leaders don't reflect the nation's diversity. So we're often talking with foundations about diversity, equity, and inclusion. We don't yet even have the diversity in the field that we need. I think it's the last data I saw, 80% of all full-time paid staff are white. That's 2015 data coming out of the Council of Foundations. The other point that Karen made, communities of color are underfunded. It is in case in 2014, only 7.4% of all dollars granted by foundations in this country were targeted for people of color-led organizations. And historically, since data has been collected by the Council and a number of other groups, that number has never exceeded 8.5%. Now, foundations give out about $40 billion every year, right? 7.4% going to organizations led by people of color, and that figure has never exceeded 8.5%. Also, there are issues around competency in our field. Again, I don't think that's any different around other sectors. And there's this tricky piece around accountability, that foundations pretty much have opportunities to move money where they like. Nonetheless, we are actually seeing some progress in foundations being more intentional to address equity. And so when we talk about being intentional, there are three things, there are probably more, but I just leave you with as it relates to how do you take these ideas and make them apply to the work that's on your desk. One is a greater use of disaggregated data. Data disaggregated by race to design policies and programs. And whether this is data on health indicators, it's important to say disaggregated by race and disaggregated by ethnicity. So it's not enough, in our opinion, for our colleagues in the field of philanthropy to be talking about black communities solely. But we want to further disaggregate that to talk about the different populations within our community, right? Black immigrants actually have very different experiences than native-born black folks, right? So we want to know not only about African Americans, but African immigrants that are here, Caribbean immigrants that are here. So disaggregation of data is really a first step in doing equity work so you can target and design programs specific to populations. The second is analyzing the impact of any proposed policy and program on communities of color. And then the third is messaging opportunities and challenges facing communities of color. And I'll end with this slide. So these are the tools that we developed when I was at NECASey. All of these tools are on the CASey website. And we use them with foundations that we work with across the country. And those 3 points about intentionality, focus on data, analyze the impact of policies and programs on people, and message race productively, really are the 3 tools that are lined up here. The first tool, actually, what's called What's Race Got to Do with It, helps folks develop what we call a race-informed theory of change and identify policies that might be driving those bad health outcomes for communities of color. And we've all seen theories of change, and if you start with the disparity data, say birth outcomes or infant mortality for black women or Latino women, this tool actually helps an organization, a community, right, identify what might be the policies that are driving that bad outcome that have the adverse effect on Latinos and African Americans. So that's the first tool. The second, I think, is the most powerful tool and a tool that we can all pick up today and use now. It's a racial equity impact analysis. Again, we're not primed to look at the impact of policies and programs and our decisions on different racial ethnic groups. A racial equity impact analysis is akin to an environmental impact analysis that suggests before we do anything to the land, we need to think about what the impact might be. Well, a racial equity impact analysis says before we do anything to people, we should really think about what the impact might be. And there are several states that have now legislated and now require racial equity impact analyses to be carried out publicly. Iowa is one, Connecticut is another, particularly in the area of criminal justice and sentencing in particular, so that there's thoughtful conversation, right, about what might be the impact, what might be the unintended consequences of these policies on different population groups and particularly communities of color. And then the last tool, and I'd be happy to talk about any of these in the conversation further, is a tool that we call How to Talk About Race. There's great work being done or has been done around messaging race that helps us to understand how you can frame race that actually keeps people at the table, keeps them engaged, doesn't have folks go running out of the room, and most importantly, doesn't blame the people, particularly the people of color, about what's happening to them. So again, the good news is that there are tools, there are resources out there. Would be happy to share more, but I think I got that 1 minute sign about 3 minutes ago. So I want to thank you for your attention and thank you for what you're doing. Thank you.
So I will just remind you to send your questions on down. We have one more speaker after the break. We will take a 15-minute break, and then we'll be right back in. Oops, here we go. Our last speaker this morning is Theo Wilson, who's the executive director of Shop Talk Live, Inc., which uses a barbershop as a setting for community dialogue and healing. Theo's always had a passion for social justice and poetry. At the age of 15, he launched his speaking career with the NAACP. He also has interned as a full-time actor at the St. Louis Black Repertory. In 2013, Theo began speaking with Rachel's Challenge, an organization dedicated to ending school violence through compassion. He's a founding member of the Denver Slam Nuba team, which Tolawanimi yesterday, was also a member of Slam Nuba. And Slam Nuba won the National Poetry Slam in 2011, and he's the author of Law in Action. Please welcome Theo.
Hi. How you doing? All righty then. Let's get started. How many of you in here have ever had hair that needed to be cut? Nice. I remember when I had that problem. Oh, the 90s. My boyhood days, man. I remember specifically being in barbershops when I was a kid, specifically because I had a lot of hair. I had the tall kid in play box. Y'all remember that one? You know what I'm talking about? That thing that looked like you just had like a wedding proposal jewelry kit like right on the top of your head. I had that, but I also had the slope, I had the Gumby, had it all. But one thing that was going on in these barbershops was that I was getting culture. These guys who were cutting my hair were also cutting my hair while involved in conversations. And these conversations were something that anthropologists are now calling environmental learning. I was picking up identity through the men around me who were simply doing their jobs, and a lot of them were from places from highly black populated areas, Louisiana, I remember, Detroit, some of them from California. So I never, while growing up in Denver, felt the lack of black folks going on at all. I felt like I was always surrounded by folks who looked like me. And I didn't realize that that was purposely engineered by my parents. Some of y'all know my dad, a cat named Sid Wilson, who's in charge of A Private Guide Incorporated. Back in those days, he was just Sid from Brooklyn. And what he wanted to do was make sure that his son got the black experience regardless of whether or not he grew up in the environment that my father did, right? And what was interesting was the time period. In that time in the 90s, the black community went through this very strange split. It was a dichotomy that was a result of integration. On one hand, you had a great advancement into corporate life. There was a huge explosion of the black middle class at that point in time. We had access to things that we never had access to. And that is a direct result of the civil rights movement and the actions that our forebears took. And then on the other hand, you had this other segment that happened at the same time. I just call it the crack era. The era of Snoop and Dre, the era of Tupac. The things that I grew up being influenced by when I was outside of my father's reach. I was on the schoolyard, right? I was in the neighborhood doing what I had to do, and I was learning these things environmentally. And one of the things that I did not realize is that I was looking at internalized racist trauma playing out among black folk. What happened when you keep telling a kid that he's bad? He eventually believes it. What happened when you keep telling African people that they are the N-word? They believed it. And I got called that a lot by black people. But it was in the term of brotherhood. I think we've all had this discussion at one point in our lives. Why do they get to say that to each other and I can't say that to them, right? Well, for me, that was just a part of life. And what we were looking at in that era was a reckoning of the internalized hate with new opportunities. And that there was this middle class that was getting all this light. I call that the Cosby era, right? There was a Cosby era and there was a crack era happening simultaneously, right? Now with that, black identity began to change. And we began to go through an identity crisis as a result of that. And so the things that I was afraid of most often were from folks that looked like me. I remember just growing up, my first incidents of like seeing crack cocaine was on the schoolyard. I remember my bullies wearing rags that denoted a certain set, a certain gang. There was a lack of trust in the community. There was a lack of the ability to say that this person is a friendly. This person is not a brother anymore. This person is not a sister anymore. And so around that time, I did join the NAACP. And to me, they were too focused on fighting the external enemies. I wasn't concerned about the Ku Klux Klan at that point. I was concerned about the Crips, the Rolling 30s, right? What were we going to do to address this internalized self-hatred? What were we going to do to rebuild the bonds? Well, after I graduated college, I came back home to Denver, and there was an organization that was called CORE, Colorado Organization for Racial Equality. They were backed by the Daniels Fund, and I got called into a meeting, and they said, why don't we do this? Why don't we organize what's already going on in barbershops and make community forums out of them? Hey, Theo, you talk good. How about you lead them? Okay, all right, that's fine, whatever. So we began to do that. And I remember just, it was like men only. It was like, the man tribe. We had to get together and talk about things that men talk about, But specifically, there was a wounding among black men. There's a lack of trust among us. And we didn't feel comfortable talking about those things in front of women, because we felt that we would be judged, and the female gaze affects men in a certain way. And so we just got these groups together, and we began to build, starting right where we were. And the leader of the organization got shipped off to the military. And I was like, what am I going to do? I didn't have a good foundation of how to run an organization back in those days. So it fell apart. 2012, he calls me up and he says, hey, how about we start this up again? I was like, where are you, bro? He was like, I'm in Washington, D.C., and it's huge out here. We want you to be in charge of the Denver chapter. So we began Barbershop Talk again. And this time I said, we're not just going to talk, but we're going to do. We're going to start branching out into community action. What I didn't realize was that I was on the cusp of a new epoch in history at this point. 2012 was also the year that Trayvon Martin got shot. So we were already creating these safe spaces for the African American community to go before the Black Lives Matter wave hit. And because that was there, we were already like a net. So we ended up absorbing this momentum. And then I was asked to do stuff like write grants, which was scary because it had all of these things called details that I wasn't necessarily good at. But over time, I learned them, and I began to build an organization that was a legitimate community functioning grassroots organization. And what I noticed is that in this new era, in this new epoch, what I was faced with was a feeling of defeatism, that we've trod down this road before. And anything that looks like advancement for our community, we've already done that and failed. Now, this was a new challenge for me. I didn't understand exactly where to go with that, so I started saying, what did we miss along that whole way? What was swept under the rug? What things aren't being talked about? Let's bring those to the forefront. And one of the things that we never really understood was the effects of a specific kind of trauma. That's transgenerational trauma. And that what you learn environmentally, like I said, gets passed down from generation to generation. And a lady named Dr. Joy DeGruy has talked about that, has written a book about it. Who's heard of Dr. Joy DeGruy? That's all right. It's not a cool kids assessment. You ain't going to be quizzed on this. But Dr. Joy DeGruy talked about transgenerational trauma. And she said, how did you learn to bake a lemon meringue pie? You learned because your mama taught you. That's how you learned. How do you know that she got the ingredients right? See what I'm saying? And we learned that about the formulas and the recipes for life. Addressing this transgenerational trauma thing It's the main focus of what Shop Talk Live does now. And it was kind of politically incorrect when we decided to focus solely on the African American community. But the fact is that minority doesn't encompass everything for everybody. People in the Latino community won't necessarily be as concerned about anti-Semitism as somebody in the Jewish community. You see what I'm saying? We have specific issues that we have to deal with. What on earth does this have to do with medicine? It's a great question. Well, there's something called iatrophobia. Iatrophobia. I thought that was a really cool word. I said it a lot of times in the mirror this morning to make sure I said it right today. Iatrophobia, the fear of medicine. You're treating these communities who have been traumatized by medicine. And the trauma around medicine in the black community has not really been delved into. There's a wonderful book that I want y'all to look into. It's called Medical Apartheid. Medical Apartheid by a woman named Harriet Washington. And in Medical Apartheid, she addresses race-specific iatrophobia in the black community, the very things that I was trying to address. Where does this distrust come from? It comes from an experimentation history. We weren't just slaves, we were guinea pigs. This is some pretty dark stuff. I was told to kind of lift things up. I'm going to do it later, I promise. But let's get into the meat and potatoes of what we're actually here to talk about. Inequality was something that was seen as science in the 1800s. Black physical inferiority. Now we, like, the general stereotype these days is like, no, they're pretty good physically, right? But back in those days, that wasn't the case. And that was also thought to be a thing with the mind. The fact that I'd be up here talking to you in plain English was looked at as scientifically impossible 150 years ago. And because of that, it was likely that black bodies would be thrown into experiments. There is a statue in Central Park in New York City of a gentleman who is revered as the premier gynecologist that has ever lived in this country, who was the highest paid medical doctor of his time. He used black slave women that he bought to experiment without anesthesia. The speculum was evolved from 2 pewter spoons that he used to put into these slave women. We heard about the Tuskegee experiments. Now, that's not to be confused with the Tuskegee Airmen, who I'm a descendant of, by the way. My grandfather, Theo Wilson, was a red tail, right? But the Tuskegee experiments, what's not talked about is how long they lasted. They began in 1942 and ended in 1972. 1972. 8 years before I was born. I'm a millennial, barely. I'm like a Gen X and X-millennial. I think I'm a zennial. I think that's what they call it. But this is the thing that you're dealing with when you're talking about addressing underserved communities. It's not quite underserved when you look at historically. It's abuse. When you understand what Henrietta Lacks is, who knows about Henrietta Lacks? Yeah, she's getting a lot of light and attention. Cured polio off of herself. Amazing, right? And so we would like to sweep these things into the past, but they are not the past. They are still with us even today. Because when I held a Shop Talk Live about the vaccine debate, which is not really a hot button issue right now, right? The vaccine debate. The iatrophobia of the community that I serve came right back. And there's evidence on both sides that's pretty compelling, but I'll tell you this. I don't want black children not to be immunized because of a cultural fear that we have that is based in real terror. So how do we get past that? You got to understand what you're dealing with when you have these folks in your offices. If you do not, you're going to trip over some landmines. And I don't want to stand on this stage here today and not put something in your brain to at least understand that there might be a little bit of extra mile that you have to go to. And it might serve you as well to understand how transgenerational trauma affected white people. You see, we talk about this diversity thing. We talk about examining white privilege. And I asked myself, you know, if I was white, why on earth would I give this up? Why? Some good stuff, man. You get to be president without qualifications. I like it, right? Trauma shows up through an emotional lens, y'all. It very seldomly has anything to do with logic, as my good folks pointed out over here earlier. And that emotional lens for white people often, or people who would classify themselves as white, damn, I hate these definitions, don't y'all? Aren't y'all getting tired of this stuff? But listen, folks who we would classify as white people have a trauma as well. And that trauma is around feeling, I'm getting into the feeling world now, unfairly pointed out as a bad guy that you weren't trying to be. And that comes from people who unfairly felt that they were being victimized, and often they were. And then that bias thing kicks in, and you're the target, right? Breaking that down, examining what that does to you emotionally is going to be the thing that gives you the emotional latitude to deal with some very difficult folks who walk into your office. I'm sure you've seen them. I've been one of them. I had to examine my own iatrophobia when it came to my relationship as a black man to the medical field. But I believe, and I strongly believe, that the time has come for this to be addressed because the momentum is there. And I like what I'm seeing. Somebody asked me, how do you feel about this conference? I was like, well, they trying. I got to give them that. I got to give some folks some effort who extend themselves to make themselves at least open to the idea of new possibilities. This is the hardest stuff that you're going to have to deal with. And you're diving right in. And I appreciate y'all. Can y'all give yourselves a round of applause for that? But just saying, I'm going to try. I'm going to give it, I was going to say the old college try, but I just said try. But the point is that it's not easy. And I understand that this is something that if it doesn't get right, like people die, that's a hell of a responsibility. I have compassion for that. But one thing that I'm reminded of is that we've come kind of a long way already. The things that, like, we take for granted in the modern world. The fact that I'm up here talking in Keystone, Colorado, black enough to be recognized as black down the street. That's what my family calls far away black. That's a different kind of thing, intraracial politics. We're gonna get y'all on that in a second. And to be seen as somebody who actually has something valuable to add means that somebody who doesn't look like me made some strides as well. And that's what I most appreciate about this convention here today. So with that, honestly, I'm going to sit my tail down, and we're going to have us a discussion that delves into the things that matter the most. So once again, I have time to like pump myself shamelessly. Now, so the organization Shop Talk Live, we are right now registered as a community organization, and so we're open to folks who want to have these dialogues. They are held at the Montbello Barbers. Who's here's like Denver-based? Who do I got my Denver-based people? Yeah, all right. She was like, yeah, all right, I love you. She's so much. She's like Ms. Fowler. She's an amazing lady. But we're Denver-based. And we are also now opening up in Aurora. And so it's Montbello Barbers, 48th and Chambers, every first Wednesday of the month. And then we have Quality Care Hair in Aurora every second Monday of the month on Mississippi and Chambers. We do a lot of work on Chambers because I got a poetry venue I have to run tonight on 6th and Chambers. So, yay. But come on out if you want to have these community dialogues. We are shoptalklive.org. And we are Shop Talk Live, Inc., Colorado. And I got a book where I talk about my journey into activism and what that meant coming from the circumstances that I came from. So it's called The Law of Action, and it can be found on Amazon. All right? Thank you all very much for your time today. I'm going to leave now. All right. What's up? Or sit down? Oh, yeah, I was told to sit down. I'm going to do that. Nice. And thanks for the water, by the way. It's awesome.
Got to rearrange the stage here for a second.
Yes, he was.
Susan and Theo just made a connection. His
Grandfather was my wedding photographer.
his grandfather was her wedding photographer.
Yeah, Tuskegee Airman.
When you said Tuskegee Airman, he was a friend of my father-in-law, who was also a Tuskegee Airman. And when you said Theobald, I said, that's a name that...
Yeah, that's not a common name. Wow.
Wow.
Oh my
Yes.
God. Oh my God.
Yes. Small world.
Small world indeed.
Yes. Okay.
One more. Jeremy, can we get one more handheld mic up here so we don't have to pass it one around for 4 people? Thank you. Ooh, this is a low chair. So we got a lot of questions so far. I know we won't be able to get to them all, but there were kind of 3 main categories in the comments and questions. One was, people calling out, other implicit biases that either they experience or they're working with people who experience around and I'll ask you to comment, what are some of the biases, implicit biases around like poor whites? What are the implicit biases around the disability community? What, biases around just last names? And I'd even say first names in some communities. And then what are the implicit biases around ageism and as us aging? So I'll just let you randomly just kind of talk about those things or other biases that you are aware of. Implicit biases. Who'd like to start? Kathleen?
I think that what we shared in particular about racial bias is true of all the other kinds of isms that were just referenced. And if you take a look at the media and how different categories of people are portrayed, you will see evidence of those biases, and we are in fact absorbing those as well. I mentioned the implicit association test, and if you go online and check that out, it's like 40 different categories that they check, including all of the ones you just mentioned and then some. So our brains are always categorizing and organizing and making meaning, and because of the way people are portrayed and because of our history as a nation and how people have the advantages and disadvantages that people have had access to, those are all inside of us. So all of the research that we just shared about racial bias applies to all of those other isms as well.
What I struggle with is when the bias is linked to your survival instinct. And on this side of the racial equation, black folks' bias against the medical industry is linked to our survivability. And that is probably, as you can imagine, a huge mountain to climb. Because what might be necessary is a self-examination of the net outcome of the medicine that you practice. What is the net outcome to this community? Now, there are certain things that you're not going to get from the local herbalist. We understand that. If I get shot, I'm not going to the lady up the street who's going to put the oregano on it. I'm going to need a doctor, right? I'm going to need a hospital. I'm going to need an organization who actually has the resources to take care of me. But I believe that it's going to take like a large effort to really personalize yourself to the people that you serve in order to break that down. Because the survival instinct linked to the bias thing is something that it's going to just be hard for anybody to let go, as you imagine.
Well, I think, as Kathleen said, that we are primed to make these associations and assumptions about a lot of different groups. What I would call out, though, is that let me just use this example. The biases that come to mind, implicit biases about poor white people, is significant and important and different. That when you have, we've seen the law enforcement issues, we've seen the police shootings, and we see that there's an overwhelming number of police shootings of black men differently than any white man. Now, I'm not calling that out as one that they're both the same or that they're both equal or one's better than the other or worse than the other, but we see that there's a different impact based on, but the bias is still there with these various populations, and there are different outcomes from that bias that we want to take into account. So it's just, it's something that when I think about what is implicitly in our brains, I want to go back over and over and over again to the wiring that happens, and how the wiring happens physiologically in our brains is due to what we are taught and what comes our way. It's not something that I was born with, but comes our way. So what's coming our way differently about these different populations, and what are the different impacts because of that? Something I want to pay attention to.
I just wanted to respond to what Theo raised, which is the work that we are doing is about raising awareness of when the bias is kicking in, and it's not to say we shouldn't have them, but it's about intentionality. So it may be that a bias I hold helps me survive or helps me navigate the world. What we're talking about when we're talking about implicit bias are those biases that are operating unconsciously and having detrimental impacts, and ones that we don't want to have. So important to call out that I think some of the biases we hold about based on how we've been treated, those are legit, and that's not to say that we shouldn't hold those to take care of ourselves, but it's about being intentional about which are the biases that are serving my purpose.
Keynote, others that come to mind for me as relates to race and gender, particularly for Black women. I'm watching the way in which Maxine Waters is being sort of dragged through the mud right now, because she is requiring, right, that laws be followed, that rules are followed in Congress as we have some of these tough debates, and she's getting slaughtered. So being a Black woman that is strong often means I'm angry. I'm an angry Black woman. That's one that clearly is at the forefront. And then I just think about colleagues that we work with in Asian American and Pacific Islanders in philanthropy that talk about just that stereotype and bias about all Asian folks doing better, that really sort of the model minority kind of, sort of stereotype that really makes their work really hard as we talk about sort of some of the ethnicities like Samoan populations, Cambodian populations, but those come to mind as well. Yeah.
There was a thread in that about implicit bias that I'm presuming came from people of color, because there were comments about either they said as a person of color, or there are biases. We talk mostly about biases that folks may have against people of color, about people of color. But what biases do people of color have about whites? And some of those are people, wrote their comments that they were strong biases, that they have to catch themselves. And so let's name some of those. What are some of those implicit biases that people of color have that are against their own values about whites?
Well, I'll break that down real quick. It's just about, we still, to this very day, still trust them more a lot of times than we do our own folks implicitly. And then when we get like a Black doctor, then it comes up like, okay, I can at least consciously talk to somebody who looks like me about it. When he did that experiment, it said that, that even Black people have a lessened compassion for themselves. That is true more times than you would think. And now, then there's the other kind of Black folks who have a deep training to see the other side of the equation. And then there are those of us who view whites very distrustfully. And that is something that will become more apparent to y'all as you go into these communities, especially because of what's been going on lately for the last few years. I feel like we regressed big time in terms of what unity might look like. But a reaction to that is that I got to look out for me. And oftentimes, white people do not have my best interest at heart. So there's two sides of the coin.
I would just say as a white woman doing the work, I take that as a given. That if I am doing work in a multiracial context, I don't presume that anybody in the room would trust anything I'm saying, any person of color, and that is trust that has to be earned over time. And so I think as somebody who works with young people or works with adults, being aware of that as a white person, that comes from a place because of the way we, white people, have legislated and created policies and done things to communities over hundreds of years, that why would someone trust someone who looks like me? And that has to be earned, and that's about building relationships.
So I'm just, my blood pressure's going up now. I'm starting to sweat a little bit, you know.
Equal opportunity, ouch, done.
Exactly. Because of this, like how many times, and I'm revealing something, how many times have I said, and you can complete this sentence if you want to, but how many times have I said to myself, if one more white man does ... I'm gonna, boom. So the way that some of the biases have set in, I want to say that, yeah, I've got some bias towards white people and certainly towards white men. If they step in front of me on line again, right?
You got one more time, brother.
Yeah, one more time. Go ahead. And it actually happened not that long ago, in an airport security line, where a white man stepped in front of me because he perceived me as moving too slow with taking off my shoes, and stepped in front of me and went through, and I'd had it. And I had just gotten through saying over and over again, however many times, if one more white does that, then I'm going to interrupt it. And he happened to be the one that got the gift. So, and the gift, I mean, I'm not going to take him down or anything, but I stopped and I looked at him and he looked at me and I just said, why did you do that? And he went, blah, 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 blah. And he says, well, then you go ahead and go in front of me. And I said, no, you're there now. You just go, but I want you to understand, I want you to think about why you did that as you walk through the security. Think about that. Right? So the biases that I know are inside of me, I want to say are because of the way that I've experienced oppression and because of the way that race and racism has come my way and because of what I've paid attention to. So, I have paid attention to certain things that white people do. I have paid attention to, and there's actually a reason why I should pay attention to that. Like it's a good thing to notice that, part of the survival, part of that. So yeah, it's to me, it's like, yeah, let's recognize that people of color have biases too, and let's recognize that those biases sit in us. You talked about healing in some of your talk, Theo. Talk about some of the ways that we have to heal from this too.
So let's talk about some action now. So a big theme through the questions was then, so what do we do? How do we reprogram ourselves from these implicit biases? How do we rewire our brains? How do we get more adept at recognizing them and responding to them quicker? So, what is a person to do? What's an institution to do?
Yeah, just first I think awareness is really important. One of my sort of responses to the biases maybe that people of color have against whites is that we think often that whites are intentionally being racist, that whites understand the impact of what they're doing. And often I say, no, it's just clueless. They don't have to think about it, right? So I think for me, information and education is a powerful tool. The material that we shared today, we don't get to learn these things in school. We don't get to talk about these things. So first and foremost, that's why I spend most of my time, a lot of my time, just educating folks on these issues. The other is that I do think I think we need to normalize the use of some small tools, things that we can do. And I mentioned this equity impact analysis. It sounds like a big formal thing, but basically the notion is whenever discretion, when we're making decisions Whenever we get to points where we have to make a decision, discretion can seep in and will seep in. Bias will seep in. And we can just get, I think, better at identifying those places, whether they're big decisions vis-a-vis where money is going, how policies are moving, where we need some guardrails or some handrails sort of to help us, look for and be primed for racial impact. So I think just normalizing some of these tools that are out there is a way to go. And the good news is that there are resources out there. But awareness and then normalizing some of the practices that folks use.
Let me let you answer those, but then I want to come back to the practices question.
Oh. I think one of the tools I had to develop was cultivating a space within myself that I could live apart from the narrative of my political identity. I had to become more spiritually in depth with just the way that I was processing this stuff, because I've physically been beaten by the police before. Like I got tied to handcuffed to a chair and beaten by the cops, and so that trauma got reawakened like in 2013, 2014, especially the incident with Eric Garner, because that was a lot how my incident looked as well. The only tool that I had was, and I don't want to get like wooey, but I had to get a little spiritual. And how that looks for you, I'm not attached to any ideology or religion, by the way, but I needed a space that I could go where I could just be me, apart from the narrative of me. And when I detached from the narrative of me, I also detached from the counter narratives. So I began to look at white people primarily as folks trying to get through this life like me and have a certain set of conditioning and programming. I'm trying to get through life, and I got a certain set of conditioning and programming. Doing this will not conquer institutional racism, by the way. What it did for me is just give me the latitude to become free from the things that would traumatize me immediately and give me at least a barrier where I can negotiate this. Because what was happening to me was I was imploding. Every time a brother got shot, every time somebody got beat up real bad, you know what I mean? That was me, and I was identifying so closely. I was like, wait a minute. Who am I in this moment? Am I in immediate danger right now? Is somebody attacking me right now? Then breathe, bro. Breathe. And that began to be my practice. And I encourage everybody that when we talk about these external things, also get real internally about who you actually are as an awareness.
I go back to relationships and to human connection. We live in communities and neighborhoods that are now more segregated than they were 50 years ago. So the chances that our kids are growing up and going to school only with kids that look like them are greater. So we have to make an effort. It doesn't just happen naturally because we have these unnatural arrangements that we've created. And when we have relationship, we get the opportunity to listen to one another's stories, and particularly for white people, listening to the stories of our friends and colleagues and neighbors of color, and just listening is a big part of what we need to do. And not rely on the people of color to process that with us, but to process that with other white people and understand what that is and what it means. And then, most importantly, carrying those stories into the boardrooms, into the decision-making venues, into the places where we have power, and never forget those stories. So they're informing the decisions that were made and the discourse and dialogue that we're involved in.
I'll just add that for me, it starts with me looking in the mirror and staying awake. I like to use the metaphor of the Matrix, those of you who know the movie The Matrix, where waking up is how you get to liberation. And so the red pill in the Matrix, where you take the red pill and the reality of what's happening around me is revealed, and then I have to do something with that reality. In some cases, I have to look in the mirror and see what am I doing to maintain or perpetuate the inequities And sometimes I look in the mirror and say, I need to heal from something. And sometimes I need to look in the mirror and say, what action am I going to take now? And what action am I going to take with others? So that staying awake is something that's important to me as an action for myself. And then I actually do take it on to try to help others wake up. So I used to go around carrying red and blue M&Ms. And in certain settings, if somebody said something or did something, I'd go and just drop a red M&M on them. And some people who knew me knew that was code for, oh, he's seeing something I'm not seeing. And that's not to be arrogant about it, but red M&Ms have been dropped on me too, right? Because I fall asleep and sleepwalk into the matrix that's maintaining the conditions. So if we're going to change, for me, it's like it starts with me, but then I have to take my awakening and move it into social action.
So every person in this room has dedicated their career and have dedicated their lives to making the people around them healthier and helping change their lives. So that's a given for everybody in this room. And we all work in institutions, some large, some small. And because we all have implicit biases that somehow leak themselves into decisions, how do we go back and look in our organizations and root out the policies and structures that we've unintentionally put in place that are negatively impacting people, impacting our work and the outcome of our work? What do we do?
Yeah, no, I would start. I really would start with, it's interesting, using the lens. What's powerful about this work and the awakening and the increased awareness, I will say to all of you, you will start seeing things differently. You'll just start seeing things differently. And that's a good thing, actually. The more information, the more learning and education that we all do about this, we'll get more primed to see these, barriers that we put in place that are right in front of us, how we're hiring people, right, how we're promoting people. So that is a very practical tool, that impact analysis. It's 5 questions. It's actually 5 questions that you can go through in your head, or you can have a conversation about, right, with colleagues in your organization, colleagues on your board, about the potential impact of what you're doing, how you're investing, the services that you're providing with different groups. So that's one. I guess the other, Karen, you spoke very clearly about it before in terms of what the foundation's doing. All of the tools that I actually was sharing that we sort of created for foundations in particular don't work if the community that's most impacted isn't in the conversation, right? So that actually has to be part of the culture of the organization, is that you're having this conversation about the potential impact of what we do on Black folks, Latinos, Native, Asian Americans, gay folks, folks of different abilities with the constituency that's most impacted. So that then requires us to change our culture to ensure that we're engaging people that are hit the hardest. Yeah.
I think I would just build on what Hugh said about looking in the mirror. Oftentimes we're doing this work and we're thinking about it as out there. But looking within our own organizations is a great place to start. How, if we have underrepresentation of particular people, if we have meetings in which some people dominate and others don't have don't have room to move in, if decision making is unclear, all of those things can contribute to an inequitable environment, which makes us less able to do the work and the mission-driven work that we're doing in the field. So starting there and listening to our own colleagues about what their experience is working in your organizations, it can be very difficult to do that, because I think we all, as mission-driven people who've done this work, want to believe that we're not part of creating oppressive environments, but we are. And so looking inside and then being aware always that if we have outcomes that are disparate by race, by gender, That's in the design. There's something in the design that's producing that. So looking back and saying, what is it about our design that advantages this set of people for promotions, for hiring, for success, and disadvantages this set of people? And we got to uncover that.
So I would say change won't come without disturbance. So if you're in institutions, and you all are, in organizations, and you don't have anything disturbing going on, then you're not you're not producing change. So to look at where can you bring disturbance, and that doesn't mean you're taking something down or you're ruining the organization. I'm not talking about that, but I'm talking about looking at what are the practices, policies, ways that you go about your work that you've gotten comfortable with. And if you're comfortable with it, then how do you get uncomfortable? So we worked in a lot of schools, and we came into schools and asked them to look at their disciplinary practices, especially implicit bias connected to their disciplinary practices, and noticed that people got uncomfortable when that was brought forward. Well, what are we going to do if we're not referring all these kids? Well, how are we going to handle all these kids? We don't have any system set up to do this. But they are doing something wrong, aren't they? So we had them actually doing inquiry, like what if? What if what? Well, what if we didn't send them to the office? Well, what if we stopped sending our children of color to the office for what's being considered behavioral problem? What if we stopped doing that? And the systems that stopped doing that started noticing something else was going on, but it disturbed them first, disturbed the adults in the system first. So I would say that if you can look at an inquiry, take an inquiry stance, like what is it that we are doing here that we've gotten real comfortable doing, and bringing in a question that produces some kind of disturbance, then you actually have a pathway to looking at something differently in your organizations. But if you don't do that, then you might be just perpetuating.
Go ahead.
I would say learn the history of the folks you're serving and where you fit into that. Because history is context. One of the most dangerous things about American society is that it's habitually ahistorical. We whitewash textbooks, and therefore we whitewash the narrative, and we wonder why we can't get things right with people of color. If you don't understand what your institution means historically to the folks that you're serving, you do run the risk of repeating that history. And so there are resources out there. I gave you a couple books to look into, but honestly, history recontextualizes the things that are going on right now and then gives you the right action by eliminating what wrong action was in the past. So I would say overcome America's addiction to erasing history.
And it picks up both on history and disturbance. And all of this is regardless of where you sit in your organization, right? Because change around these issues often doesn't come from the top, right? We've actually framed something that we call leadership from the middle. And I can tell you, more of the foundations out there, organizations out there that are leading on issues of equity came from courageous disturbances from folks that were sitting in, program officer position, administrative assistant positions. So again, this isn't about position in terms of organizational and institutional change. It's about leadership, and leadership can come from anywhere.
So I think that your last comments really lead into this, the third large theme of the questions had to do with, are there trade-offs? What are the trade-offs? Because some folks said, well, it seems like someone or some sector of society is going to have to give something up in order to achieve this health equity. And then kind of tagged on with that is, so then how do we have these conversations? How do we work towards health equity without framing it in such a way that white people feel blamed, feel antagonized, and feel defensive?
Talk about that one. Let's stop defining race as a zero-sum game. I think there's definitely win-wins for everybody. You know, this idea that if they gain, I lose, makes people aggressive, I think. It sets up an artificial scarcity model by which you are perpetually being chased down. That progress means that you're no longer the big shot. And that applies across you can say that for heteronormative folks. You could say that in any sector, ableism, you name it. The whole idea, the premise of the statement, all men are created equal, and women and trans folk and everybody, is that there is an innate human potential that cannot be wasted. Why wouldn't you be happy to actually be a part of the work that spares and cultivates human potential in everybody? Reframe that zero-sum game out and make a structure perhaps, and I don't know what that looks like for you, but make a structure where everybody wins, and I promise you will then incentivize, not just appeal to the moral rightness of a thing, but incentivize a win for everyone. I think that's how you could do that.
We draw a lot on the work of John Powell, who's at the Haas Center for a Fair and Inclusive Society at UC Berkeley, and he talks a lot about linked fate. And I believe that. I believe we as white people have suffered a tremendous amount to our own humanity for perpetuating and being a part of perpetuating racism. And we don't get the benefit of the gifts of our brothers and sisters of different cultures and races if we are too busy hoarding and running. And we lose for that. I think of the ecological model and the idea that we are only as healthy as the most unhealthy part of our community. And if I think about the community I want my children to grow up in, I want them in a community where all the children around them are thriving. They're not better off if there's some set of kids who are pushed out into an alternative school or pulled away into special ed and they just get all the good instruction to themselves. They aren't. The health of the whole organism and the whole community is suffering when we don't take care of one another, and we're all going to be better off if we take this up.
Well, I just simply reject the notion that somebody has to give it up. I think that we do have the possibility of being in a win-win solution when it comes to any areas of inequalities. Now, for me, I have to come from that place in order to see it. We can have a win-win solution. We don't have to have populations that give something up in order for others to have something. It doesn't have to be that way. That comes out of a European, individualistic, cultural way of being. We don't have to accept that. We can actually come from all of our indigenous roots, because all of us have indigenous roots, and we can become more collectivist in how we are moving through the world and find those win-win solutions. I totally believe that we can do it. And I also know that if we find that, the win-win, that when everybody is lifted up, then we are in a different society. We have the research that shows that societies that have the most inequality, everyone's doing worse. Everyone is doing worse. From the 1% down, everyone's doing worse. There are some who are temporarily doing better, but they're only temporarily doing better. And in societies where equality is at the root, everybody's doing better. So we actually have ways of being collectivists and having it be win-win. So my response to that question is, yeah, I just don't accept that it has to be that way.
It's real research, as you mentioned, Lived Fate and Frameworks Institute, who we've done a lot of work with, calls it shared fate. There's actually a lot of research that suggests if we can help people understand, white colleagues with power, about how their experience really is connected, there is a shared fate in this country, then we can unite people around sort of ideas and concepts that typically sort of separate us. I use the sort of criminal justice reform sort of policy conversations that are going on now. So, so I know that I too don't, it's something we can't fall for. We are organizers, though, and I do think we have to get savvy at messaging with different groups of folks. Ultimately, this is where it's coming from. But there are a number of things going on around the country around the business case for racial equity. People are using frames to bring folks in to better educate them on why this is ultimately good for all of us. And so, again, I think we just have to get sophisticated around our organizing and our tactics and our messages. Yeah.
One last connection. I really believe we are very sick as a country, and I believe that racism is a public health crisis. So when we're all suffering, when we look at the state of the way that we are taking care of our children and our elderly and one another and the violence that is happening in our communities, it's an illness and it's a public health crisis that if we tackle together, I really believe we have a shot. But without taking it on head on, I think we're not going to get healthy.
Let's thank these panelists for their contributions this morning. Now, before we break for lunch, a couple of things. Some of the questions were like more directed towards the foundation. And so if I have an opportunity tomorrow, I will address some of those around how we're incorporating this, how are we going to measure inequity, a lot of those kind of questions. I'll address those tomorrow if I have time. There are a lot of questions we couldn't get to, but I'll leave you with a few of them so that you might want to discuss them with your colleagues over lunch. So there's a couple that were around our own hiring practices, that if we have master's required degrees as positions, knowing that there's certain populations that are underrepresented in master's and doctoral programs, are we then culling the herd intentionally? So that's something to talk about. Okay, this is I don't even know what this means. So people who are much smarter than me will know this. Somebody said, what about and I think it says amygdala hijack. Is this when we are totally driven by our unconscious biases and impulses? And they referenced the Blink book by Gladwell.
Short answer, yes.
Short answer is yes. So those of you that are familiar with the amygdala hijack, y'all discuss this over lunch. There were questions about civic engagement, and one of the ways to help address and end some of the inequities are about getting everybody more civically engaged. And so what are some of the ways to do that, and who's working on that? There were a couple of questions around the consumer product marketing. So who's working on, how do we change this? What's the avenue to get to advertisers and manufacturers and corporations to change that? So who's working on that? Who's got ideas? Who wants to take that on? This is one I struggle with. It's about sometimes when we focus on helping those with the greatest need, we kind of create a vacuum or perception that we don't care about the folks that are right above that. Very often the upper lower class and the lower middle class. And so how do we continue to do our work? How do we maintain our focus on addressing those with greatest needs without eliminating or ignoring the needs of those just at that next level that next level up? There were a couple on cultural appropriation. So those of you that want to talk about cultural appropriation, we can do that. And then there was about language. So one of the examples was, if someone has an opioid addiction, they're sick and they're a patient, but if they have the crack addiction, they're a criminal. So how do we overcome that kind of language and perception? And then there's one again around this notion of white privilege. And how can you help a white person who grew up poor to understand the notion of white privilege? Though that isn't even all of it, but those are enough conversation starters to get you all through lunch and keep you energized for the afternoon. So we are going to break for lunch until what time? Somebody tell me what time we come back? 12:45. We'll be back at 12:45, and thank you again for your attention this morning.
All right, welcome back, everyone. How was lunch? Good. How were the discussion topics at lunch? Silence. That must mean we talked about something else, huh? Were we talking about the Rockies, or were we talking about some of these difficult topics? Well, welcome back. Again, Jerome Davis here, board chair. I'm going to introduce our next guest here for the afternoon session. I'm going to bring up Eric Liu. Eric Liu is the founder and CEO of Citizen University, a national nonprofit that promotes the art of powerful citizenship. He is also executive director of the Aspen Institute's Citizenship and American Identity Program. Liu served as a White House speechwriter for President Bill Clinton, and later as the President's Deputy Domestic Policy Advisor. He currently serves on numerous civic and nonprofit boards. Liu is the author of several books, including You're More Powerful Than You Think, A Citizen's Guide to Making Change Happen, which each of you received today. Please join me in giving Eric Liu a warm Colorado welcome.
Thank you so much, Jerome, and thank you all for having me here today. This has just been really exciting. My wife and I got here last night and got in town early enough to see the fireside chat with Chief Mullen from Charleston, and that was a very moving and powerful conversation, one that I know has been kind of woven in with a lot of the themes that you've been wrestling with and chewing on and talking about. And I just want to say, you know, I do, I'll tell you a little bit about my work, but I go to a lot of events, I go to a lot of settings like this, and there's something really special about a gathering like this, led the way that the Colorado Health Foundation is led, with a sense of purpose and a sense of social and civic mission, but also the ways in which, just again, you know, at that fireside chat last night and kind of listening around during lunchtime today, sensing how much of a community there is here, and how much you all are learning from each other and pushing each other and engaging each other in ways that are really creative and useful. So it's really gratifying to me to get to spend some time. And I'm really grateful to the foundation as well, not just for bringing me here today, but for making it possible for you all to get a copy of my new book on citizen power. So what I'd like to do today actually is talk a bit about our moment, talk about our power, and then really in the third place talk about making a different kind of case for inclusion. And those are the three chunks of what I'd like to speak about today. But before I do that, let me just give you a little bit of context about myself and the work that I do. So as Jerome mentioned, I run a nonprofit called Citizen University. We're based in Seattle, but we do work all around the United States. And our work is really about trying to democratize understanding of how power works in civic life, both at the level of skills and strategy and tactics, but also at the sense of the level of values. What's the moral frame within which people are called to cultivate their capacity to exercise power in civic life? And so I often in talking about citizenship, have a very simple quasi-scientific formula that I talk about, which goes like this: power plus character equals citizenship. And what I mean by that is that citizenship, by which I mean, by the way, I'm not talking about documentation status under the immigration and naturalization laws of the United States. I'm talking about a more capacious ethical sense of being a member of the body, a part of the community, right? A contributor, a pro-social contributor to community. That's my notion of citizenship for these purposes. And when I talk about power plus character, what I mean is, in the first place, being literate in and fluent in the ways of power, how you actually get stuff done. But then in the second place, talking about character, having a cultivated moral sense, a set of values to which that literacy in power is actually harnessed. And I think we can see all around us in these times right now the dangers of having only one side or the other of that equation, right? Power and a fluency in power without character
is mere sociopathy. But character, having a cultivated ethical sense without having any accompanying clue of how to get stuff done in the world, how to move systems, how to make institutions change, that's just self-indulgent philosophizing. And so it's the combination of these, power plus character, that makes for citizenship. And that is the way we think about our work at Citizen University and the way we think about our times. And I think, in a nominally self-governing democratic republic like ours, this work of teaching power and teaching citizenship matters all the time, right? But I think we would all agree that it matters particularly right now, that we are living through an exceptional moment in the life of this republic. And this is the first thing that I want to spend some time talking about, which is our moment. Our moment is one that is defined a lot of ways, because of what's going on in Washington, D.C., and because of the kind of intense, unprecedented nature of the disruptions of national politics. It's tempting to think that our moment began on November 9th, 2016. But it would be very wrong to think that. The moment that we are in is a moment of, well, as your conference theme really focuses on, a moment of profound inequity, a moment of nearly unprecedented concentration of wealth, opportunity, voice, and clout, nearly unprecedented inequality at levels not seen in this country since just before the Great Depression. Right? This is the moment that we're in. This is not a moment that began on Election Day 2016. This is a moment that's been in the making for 3 or 4 decades now in the United States of grinding tectonic shifts in our notions of equity and our notions of what it means to be one country. And during these 4 decades in which wealth, power, voice has concentrated into what's popularly understood these days as the 1%, although as we can get into a little bit later, the 1% is sort of a very rough, imprecise proxy for how privilege actually is concentrated in the United States today. But that language of the 1% is indicative of what we're going through right now. And I would say to you that what happened on Election Day here in this country was not a cause, it was a symptom. It was a symptom of this deep divide. It was a symptom of the way in which this country has been pulling apart and becoming more unequal. At the very same time that this country has been shifting demographically. And so when you can foresee in a matter of decades the day when this is no longer a majority white nation, and you couple that with this sense that, well, not just sense, this reality that median wages in the United States have been roughly stagnant or declining for the last generation, that even since the end of the Great Recession, 95% of the gains of the so-called recovery have accrued to the 1%. That when you couple that kind of rigging of the game economically with this kind of tectonic demographic shift, it's actually a miracle we didn't get this election result sooner. It's a miracle we didn't get this kind of disruption and this knocking over of the status quo sooner. And so this is the moment we're in. And it's a moment defined not just by the election of Donald Trump. It was a moment defined by the emergence of Bernie Sanders, who in his own way challenged every notion of status quo and establishment and who named the rigging of the game explicitly. But it's a moment defined, if you rewind before that, defined as well by the Tea Party, by Occupy Wall Street, by the emergence of Black Lives Matter, by the emergence of the Dreamers. We live in an age where simultaneously you have this incredible concentration, monopolization of wealth, voice, clout, and presence in this country. But now what we're beginning to see at last is a great push back. And I would say to you that in the United States and indeed around the world right now, we are living through a time of incredible surges of bottom-up people power. Every one of those movements that I described earlier, from the Tea Party to Occupy Wall Street, Black Lives Matter, $15 now. You name all these movements right now, and you might say, well, they haven't quote-unquote succeeded. They haven't won, right? Maybe the Trump train won, but the Sanders movement didn't. To which I say, not true. In the first place, all of these movements are part of an ecosystem of change, and each one is making the next one possible. But then secondly, I would say to you the fact that it is common parlance today to speak of the 1%. It is common parlance to talk about police killings and the injustice of our criminal justice system. It is common parlance now in the United States for us to reckon with the grinding nature of poverty wages that so many millions of Americans have to try to live through. The fact is that the conversation has shifted in the United States, and that is in good part because of this incredible phalanx of bottom-up citizen movements. And these movements, though they may come from the left or come from the right or come from points and directions that are completely orthogonal to a left-right axis, are part of this moment. And if we want to understand this moment, it's simply not a moment of business as usual. We can see that in the reality TV show of Washington, D.C. today. But it's also true just in the bread and butter day-to-day life of what you do worrying about health care, access to health, health outcomes, health disparities, disproportionality in health care and health outcomes here in the state of Colorado. Just in your bread and butter day-to-day life, you know and feel that we are in a time of great tectonic disruption. And we're in a time where people have been taking it for 3 or 4 decades, but are no longer taking it anymore, right? And to me, this is an exciting moment. Not because everybody who is now mad as hell, not going to take it anymore, knows exactly what they're going to do, or is exactly strategically smart about how to do it, or has exactly figured out the right pathway to success, but because there is an awakening right now, right? And I would say even for those who, and again, cards on the table, I have worked for a Democrat. My views in politics are generally progressive, but what I'm describing here is a completely cross-partisan phenomenon. And one thing that I would tip my hat to Donald Trump about is that this man who occupies the White House right now, he alone is single-handedly, I would say, responsible for one of the greatest surges of civic engagement in the United States that we've seen in over half a century. He may not have intended it, but there's no question that his presence has catalyzed and awakened tens of millions of Americans who had been complete bystanders, checked out, perhaps maybe somewhat interested spectators, but had not been on the field and are now stepping on the field, right? And that's, again, not just people who are in the quote-unquote resistance, resisting the Trump agenda. It's people who are reform conservatives saying, well, hold on a second. What's going on here? People like Jeff Flake of Arizona, Republican senator, saying, hold on a second. If we believe in conservative principles, is what's going on here hewing to our principles? People on the right who are libertarians saying, hold on now. You may like some of the policy outcomes coming out of this administration, but is the way that it's happening in a way that is, again, concentrating power in the Capitol something that we want to actually sign on to? There's a cross-partisan, cross-ideological awakening going on in this country. People saying, hold on a second. I don't like how this game is being played. And I think this is, to me, though it is scary and disruptive, and though no one today, I think, can plausibly predict what the state of our republic will be in 6 or 12 or 18 months, I would still say net, this is an incredibly positive thing because we are not in stasis. We are not paralyzed with cynicism. We are not stuck. We are waking up. And that is our moment. And so how does that bear on the work that you do? Well, it bears 100 different ways, right? When you have people starting to realize that their individual suffering, whether it's the fact that they live in a food desert and can't get the kinds of foods that might get their family off a pathway to obesity and diabetes. When you think about whether it might be people who are no longer accepting the fact that their part of town simply is going to have lead pipes and bad water quality. When you think about folks who realize that, hey, it's just not okay anymore to think about gun violence in this part of a community as just a fact of life, a part of nature, but that these things can change. This kind of political civic awakening that's going on in our country right now, this reacquaintance that citizens are having with the power that we've always had and have always heedlessly, mindlessly been throwing away and giving away, this awakening now will come to bear now on questions of health, health equity, and health policy. And so this is an incredible opportunity for us to begin changing the way that we actually engage communities, not as clients, not as recipients, not as beneficiaries of our largesse, not as people who need guidance and help, but as participants, as citizens, as creators of a new kind of contract and a new kind of deal in this country. Well, that brings me to the second thing that I wanted to speak about today, which is actually what I mean by power. Our power. I've been talking about citizen power. I already defined a moment ago what I mean by citizen, which is I'm not talking about documentation status. I'm talking about this bigger sense of being a member of the body. But when I say power, I mean something very specific. I mean a capacity to ensure that others do as you would like them to do. Now, for some folks, that definition gives them the creeps. It's a little bit menacing. It's a little bit like, I'm going to dominate you. I'm going to be the boss of you, and I'm going to make you do what I want you to do, right? But I really invite you, if you have any kind of misgivings or qualms about that, to set those to the side for the moment and take an honest look at life. Because in every arena of life, in every circle of relationship, not just professional, not just in the community and civic realms, but in our own personal lives, families, neighbors, friends, we as humans are always trying to get other humans to do as we would like them to do, right? The only question is whether in public life, in the civic arena, we are going to feel sheepish about naming it. Naming it and being candid about the reality of power, and therefore the reality of inequities of power, is the first and necessary step to actually addressing these inequities. If you can't even name it, if you can't even talk about power, good luck dealing with inequity. You're just going to be dancing around the edges, doing polite talk about how you want to be nicer to some people, but you're not going to get to underlying causes, and you're not going to get to the ways in which structurally the game has been rigged, and that structurally the conduits of power, institutions, networks, organizations, narratives, through which all forms of power, people power, money power, ideas power, the power of crowds and force, the conduits through which these forms of power are flowing are not conduits that God gave us one day and said, here's your power structure. These are man-made, and they are man-remade at all times, right? Man and woman remade at all times. And so becoming conscious about power and understanding that our first responsibility, not only as citizens, but for all of you who are catalytic citizens, right? Every one of you is a node in a network. Every one of you is a creator of a web of great consequence, dealing with lots of different kinds of communities and lots of different settings, trying to reckon with these questions of poor health. You have more power than you realize, right? And so the title of my book is I'm not some dude coming in from Seattle selling you some new age slogan that you're more powerful than you think. I'm stating a fact of civic life, that most people in this country have far more capacity to make change than they ever activate, and that activating it begins with naming it. Well, once you name it, there are, by my reckoning, 3 broad laws of power in civic life that are worth understanding for all of you as on-the-ground practitioners, as researchers, as policymakers, as caregivers, whatever it might be. And the laws are these. Number 1, first law of power. Power compounds. It concentrates, just as powerlessness does, right? And this is as obvious as the sun rising in the east and setting in the west. That you can put it colloquially, that the rich get richer and the poor get poorer, that those who have clout tend to get more clout. Those who get some exposure in the media as a spokesperson on issue X tend to get more exposure, right? This is the nature of systems, that advantages and disadvantages compound. That's a reality of power in all systems, even in one that is, again, nominally democratic and open like ours. Law number 2, power justifies itself. So at every turn, institutions and individuals who are incumbent holders of power love to spin elaborate stories about why it ought to be that way, about why it is the nature of the world that they should have power and implicitly you should not, right? In earlier centuries, this was what you might think of as divine right. Kings would tell you, of course I'm king. God said I'm king because I'm the son of God. Get on board, right? Today we don't, in the United States at least, believe in divine right as a basis of power legitimacy, but there are all kinds of variations on divine right in our politics. If you think about the language in the politics, for instance, of trickle-down economics, Trickle-down economics is a secular version of a claim to divine right. It says that really rich people, today's really rich people, are quote-unquote job creators, which is the equivalent of royals. They are job creators, and so we must pay them ritual tribute. We must treat them nicely, these job creators. And if we treat them nicely, then perhaps they will treat us nicely, and some of their prosperity and goodwill will leak down to the rest of us. Right? That is the narrative of trickle-down economics, and is a narrative that does many things. It justifies why those who have wealth have wealth. It justifies why you better not think about raising taxes on the wealthy. You better not think about regulating the business activities of those who are current wealth holders. But it does another thing. It subtly issues a threat. It's an intimidation tactic. It says, if you should even think about messing with me, raising my taxes, making my life as an economic royalist a little bit less comfortable, then watch out because your jobs might disappear. My prosperity won't leak down to you anymore, and you're going to be hurting. To put it in kind of gangsterish terms, it'd be a shame. It'd be a shame if my prosperity could no longer leak down to you. It'd be a shame, right? This kind of subtle intimidation tactic. Well, this is one example of this kind of narrative of self-justification. But there are others. We live in an age right now as well where in the headlines, in all our institutions, the debates about white privilege are a pretty good example of challenging a dominant narrative of why white is right, why it ought to be that the leaders of institutions should be white, why it is as a default expectation that, of course, our institutions should bend toward the preferences, the fears, the wants, the felt pressures of folks in the white community. The announcement yesterday from this administration's Justice Department that they're going to start paying special attention to the grievances of whites who feel put upon and discriminated against is one slice of this kind of narrative. Male privilege is yet another. We may think today, oh, come on, we're long past an age where people said that, you used to say in American politics that politics was for men and women should stay home and civic life is for men and women shouldn't dirty themselves or pollute themselves by getting involved with untoward types dealing with very messy issues, right? That was the language that was used 100 years ago in this country. And 100 years ago in this country, women decided to push on through that narrative and say, we beg to differ. We think we will actually organize. We think we will organize to, for instance, get the right to vote. We think we will organize to change the laws in this country around alcohol. We think we will organize in this country to show our force in all different kinds of issues, local and national. So this second law, that power is always justifying itself, is one that we often don't perceive. It's like water to fish because it's just the dominant narrative, the dominant set of explanations for how things are that we've kind of internalized, right? Now, if all you had were these first two laws, that number one, in the first place, power is always concentrating and compounding, and number two, that power is always justifying itself, you'd be stuck in a pretty grim doom loop, right? You'd be stuck in this place where like, wow, a small number of people are going to hoard and monopolize all the resource and power in this community and then tell you why you should be happy about it as they grind you down to dust, right? And indeed, all around the world, there are such doom loops in motion right now. Those of you who follow international news have followed what's gone on in Venezuela in recent days, where that country's people voted to commit democratic suicide, voted to end power of the people and to transfer power into a quasi-dictatorial body controlled by the president there, right? But it's not just foreign countries that end up in these grim doom loops of monopolization and domination and tyranny. There are communities in every state in the Union, and there are parts in every county of the state of Colorado where you can see that same doom loop setting in, where people, as Chief Mullen was saying last night, are simply without hope, simply swim in currents of cynicism, and do not believe that they can or should try to change their situation. And the economic and the psychic and the health ripple effects of that are what you deal with in your work professionally. So if all we had were these first two laws, we'd be stuck. But what fortunately breaks us out of that doom loop of laws number 1 and 2 is law number 3, which is this. Power is infinite. Power is infinite. And here again, I'm not trying to sell you some woo-woo New Age line. I'm describing to you a simple fact of social and civic life, which that it is wholly possible to generate brand new power out of thin air through the magic act of organizing, inviting one other human to engage with you on one common endeavor that requires us common goals, thinking about common strategies, thinking about common pathways around common obstacles, that this generates power where it did not previously exist. And the idea that power is infinite is important because it cuts against so many of our intuitions. We have an intuition, I think, as humans perhaps because the laws of physics tell us that, conservation of energy, that in this room, if someone's going to get more heat or energy, someone else in this room is going to have to get less because it's a zero-sum deal in physics, right? And a lot of our intuitions about things may be derived from that. But here's the thing. I'm not talking about physics. I'm talking civics. And in civics, it is possible to add to the net amount of power in a previously closed system. It is possible to create positive sum, non-zero sum outcomes by generating power where it did not previously exist, right? And that is true on every issue. So that litany of movements I described at the beginning, Occupy Wall Street, the Tea Party, $15 now, Black Lives Matter, the Dreamers, LGBTQ movements right now, all of these are living, tangible, vivid examples of the infinitude of power in civic life. None of these movements asked for permission. None of these movements got a permit to organize themselves. None of these movements said that they were going to take away by coming into existence. What they did is they brought people who'd been out of the fold, out of the loop, off the field, into the fold, into the loop, and onto the field. And this idea that power is infinite is really important because I think one of the great consequences of living in the moment that we're in right now, this moment simultaneously of grinding, crunching inequality and the hopelessness and cynicism that comes with that, while at the same time people are getting awakened and wanting to push back against that, one of the consequences is that too many people remain stuck in a zero-sum frame of mind. Too many people have gotten too comfortable justifying the system as it is, right? Well, each of these three laws actually yields in turn an imperative for action for us as citizens and for you as catalytic citizens using the medium and the methods and the metaphors of health to heal the body politic, right? So if in the first place power is always concentrating and compounding into these winner-take-all monopolized games, then our first imperative is simply this: change the game. If in the second place power is always justifying itself and creating these elaborate narratives of why it is that those who have and those who have not, then our imperative in the second place is to change the story. And then third of all, if it is the case that power is infinite and yet so many of our fellow Americans remain stuck in a mindset, an equation that is zero-sum, stuck in the sense that I can't get without taking something away from somebody, and therefore I'm not going to try because someone's going to grind me back down, then our imperative is to change the equation. And these three imperatives of changing the game, the story, and the equation of civic power are, I think, a useful way to think about our responsibilities and opportunities right now in this incredible moment. I'll give you one very hands-on example of how these imperatives play out, just in my own life as a citizen, and an example that actually bears out on this question of inequity and how we deal with inequity. So I'm from Seattle, as I mentioned, and some of you may know that Seattle was the first major city in the United States fairly recently to enact and adopt a $15 minimum wage, right? And some of you may have followed the way in which that enactment of a $15 minimum wage in Seattle has set in motion a bit of a contagion in this networked way, where other cities and indeed some other states are either going to 15 or approaching 15 or just raising the wage generally, right? But what many folks don't know is that even before Seattle did what it did, and I was on the board, the mayor's commission that actually struck the deal that got us to 15, that even before Seattle got to 15, what actually set these dominoes falling, what actually got things going, was something that happened in a neighboring little town called SeaTac. SeaTac is the airport town, the Seattle-Tacoma International Airport, right? And SeaTac is a town where most of the residents are low-wage workers, many of them immigrants, many of them people of color, working in the airline and hospitality industries, either working at the port, the airport, working in the hotels and rental car companies and what have you, serving that general industry around there. And what happened in this tiny little town of SeaTac is that a group of citizens began to organize and say, you know what? We are the backbone of this economy for this airport and this whole part of this state's economy. And if we actually come together and organize, we can change the game, the story, and the equation of power in our community. And so they did that. On the minimum wage in general in the United States, but particularly in an airport town that's dominated by big airlines and big hotel chains, and you have this kind of disempowered immigrant workforce, you have a game in which the game was classic trickle-down economics, in which the folks in power were saying, hey, don't raise wages here, because if you raise wages, we're going to have to fire people, right? And so that was enough of a threat to make people say, okay, we won't make trouble, we'll just take it, we'll just take these crummy wages where we got to work 2 or 3 jobs to actually make ends meet, because we sure wouldn't want to lose these 2 or 3 jobs that we have to make ends meet, right? That was the game at the beginning. But what these organized activists did was they began to change the game by saying, you know what? We don't have to go through the traditional legislative arenas like the city council in SeaTac or the state legislature, which are dominated by forces that sell this story of self-justification, this trickle-down story. We can bypass them. And if we get enough signatures, we can actually put a measure on the ballot. And they did that. Folks who had never done a single civic thing in their lives, had never given a public speech, had never done door knocking, had never organized other folks, started doing all these things. And they started showing up. And as they did that, they began to change the game, because they realized not only that they could bypass legislative bodies and put a measure on the ballot to raise the wage to 15, but that in so doing they were changing the story too, right? And the story was not just that these were helpless, voiceless, low-income workers, most of them women of color, but rather that these were people who were coming into their own as participants in the civic and economic life of this community and this country. And as they did so, they began to take that trickle-down economic story and flip it on its head. And they started offering a counter-narrative that said, the true source of prosperity in SeaTac, the true source of prosperity in any community is not the quote-unquote job creators at big corporations. It's us, the little people who do the buying and the working and the living, as they said in It's a Wonderful Life, right? Who do the buying, the working, and the living that actually sets in motion a positive feedback loop of increasing demand. It's us who, when we have more money in our pockets, we buy stuff. And when we buy stuff, businesses have more customers, and they end up hiring more workers. We called it middle-out economics. That prosperity, in reality, emerges from the middle out and the bottom up, not from the top down. And they changed this story. And that allowed them to change the equation of power in this community. That it was no longer just folks who were labor organizers working at big unions, fighting against chambers of commerce and having the same old tired battle they've been having for decades on wages and inequality and inequity, but that you now had lots of new folks rushing onto the field who'd never participated in civic life before, fundamentally changing the equation. Well, that ballot measure passed in SeaTac by a few hundred votes, and it passed just at the time that the city of Seattle next door was having a mayoral race and city council races. And it began to change the dynamic of that mayoral race. All of a sudden, the mayoral candidates had to hop on that train and say, we're for 15 also. Well, I'm for 15 today. Well, I'm for 15 tomorrow, right? And all these folks getting on board at 15. And this all started with a few humble airport and hospitality workers in SeaTac organizing, right? This is one simple example of how you change the game, the story, and equation to begin to shift the balance of power and address in real, tangible ways inequity. Well, this brings me to the final note that I want to say, though, about our moment and our time and understanding our power, and that is the kind of case that we make for inclusion, right? One thing that happened in CTAC, and this is true of every kind of case that I would make for inclusion, the case that I would make for why public-facing health organizations should have staffs that reflect the diversity of the communities they're serving, why colleges and universities should take affirmative action to ensure that their student bodies reflect the full breadth of diversity of the populace of this country, why police forces ought to be taking affirmative efforts to ensure that not only they have trust and relationships of the kind that Chief Mullen was describing yesterday with the communities they serve, but that their actual police forces are more reflective and representative of the communities that they serve. Now, why? Traditionally, if we're honest, in realms like health and education and economic justice, the prevailing reason why people make this case for inclusion basically boils down to this: it's nice. It's nice. It would be nice. It would be fair. It would be fair and nice to include these people, right? It's not nice to not include these people. It's not fair, right? And I grant that an argument from niceness, an argument from fairness will take you a certain distance with a certain group of folks. But if we want to actually fundamentally change the way that we think about what it means to heal the body politic, to have healthy communities where people are full-on participants in economic, civic, social activities, then the case that we make can't just be about it's nice. It would be more nice to do this. The case that we make has to be about self-interest properly understood. The case that we make has to be this, that when you raise the wage in CTAC, you're not creating some zero-sum game where businesses are now suffering and they have to shut their doors. When you raise the wage in Seattle, by the way, Seattle has just gone in its, I don't know, X number of consecutive month of being the biggest boom town in the United States, right? Our unemployment rate has fallen to its lowest level in decades. The restaurant business, which screamed bloody murder when we raised the wage for $15, is literally cannot grow, cannot keep up with its own growth. Right? Seattle is booming. Why? Because of middle economics. Because we set in motion this positive feedback loop of increasing demand. Because we showed concretely that we're all better off when we're all better off. And that showing this is more than just saying this. Showing this through something like an experiment in raising the wage. Showing this and ensuring that people with the worst health outcomes get better access to health care. Showing this in a way that is about addressing all the disparities and inequities that you reckon with, whether it's around obesity in our sugar economy, or it's around the opioid epidemic, around gun violence or teen pregnancies. All these different public health issues all boil down to the same thing. The reason to care about these things, the reason to be inclusive, the reason to embrace and activate the full breadth of our diversity in the society is not only, in fact, not even primarily because it's nice, but it's because it's the only way we will thrive and succeed and survive as a society. This is mutual self-interest, and this is remembering that all self-interest, at the end of the day, is mutual self-interest. And there's no better teacher for that than someone who works in the realm of health, right? Now, some of you I know are trained as epidemiologists. Some of you work in public health professionally. But the charge that I want to give you here in closing is this. We have to get it so that every member of our community starts seeing themselves as an epidemiologist, right? Now, that may seem like a fancy thing to do and kind of unrealistic, but what I mean is this. We got to be ensuring and enabling and empowering every member of every one of our communities to be able to see in systems, to understand the interconnectedness of all our opportunities and all of our challenges, to be able to take responsibility and to see what a false choice it is to say, is it individual responsibility or structural collective responsibility? That these things feed one another in that same kind of feedback loop, right? And that we have an opportunity and responsibility to model this. And you may say, well, gosh, this seems awfully sophisticated and complex for your everyday American, and I completely reject that notion. I've taken this notion of thinking like an epidemiologist, thinking like seeing in systems, to classes of 4th and 5th graders. And I've asked these 4th and 5th graders, what's an example of a system in your life? Hands go up. Like how water gets to the water fountain in our hallway? Yeah, that's a pretty good example of a system. What's another one? Hand goes up. Like how my favorite cereal gets to Safeway? Yeah, that's another good example of a system. Humans are intuitively primed to search for cause and effect. And young people, poor people, people of color, people on the margins of our opportunity structure in this society, some folks may think that this is beyond them. This is too much to ask of them. I say if we invite them, if we invite each other into this skill building of seeing in systems, taking responsibility for your piece of that system, understanding how social norms and attitudes and behaviors are contagious across these networks, then we will change something fundamentally. And this is what it means for us. If every citizen is an epidemiologist, then everybody in this room is a chief public health officer. Again, I don't care what your title is, and I don't care what your day job actually is. You are a chief public health officer in every circle you move in. And health in this day and age right now means teaching power. It means grabbing onto this moment that we're in, where folks are beginning to awaken. It means using this moment to open up for people an invitation to inhabit their own power, to occupy the full breadth of their own capacity to make change in community and civic life, and to change the game, the story, and the equation of how we build a healthier community and country together. I think that if we do this today, I guess I want to close with how I came to town and began yesterday, which was listening to the words of Chief Mullen from Charleston. I don't think Chief Mullen is a wizard or a person who came in from another planet who's got magical powers. I think he's somebody who followed that simple formula that I set out at the beginning of my remarks today. Power plus character equals citizenship. For those of you who heard his remarks, and for those of you who didn't, what he talked about was simply this, that he recognized that when the awful hate crimes and killings had happened in Emmanuel AME Church in Charleston, he realized the moment that he got the call that because of the responsibility and the station and the authority he had in that community as both chief of police and as a node of epidemiological capacity in that community, that this was going to be his moment of truth. This was going to be his defining moment, right? He recognized his power in that time, but he coupled that recognition of the full breadth of his powers with a deep and abiding sense of character. And that character came out not just in the compassion that he showed to the victims' families and to all those who were traumatized. The compassion, that character, came out in the way that he handled himself. It came out in the way, frankly, that those pressure-filled days after that killing, those killings and that shooting, were not the beginning, but were in a sense the culmination of what had been many years of work, of trust building, and the earning of legitimacy in that community, right? And that required being real. That required naming power and naming inequity. That required inviting folks, as he did, to participate in the reordering of the equation of power. And it required doing so with integrity and with the sense that I'm doing this act of inclusion not to be nice, not out of pity or charity, but because I want our whole city to be healthier and stronger. I want Charleston to thrive. That is character. And so every one of us now, as chief public health officers of the places where you live and work, I urge you, I beg of you, to go practice power with character. And if we do that together, I don't care what goes on in Washington, D.C. I don't care what circus happens around us in our politics, in our civic life. I believe the health of the Republic will be strong for a good long time to come. Thank you very much.
Let's give another round of applause here for Eric. So you are so right. This is our moment, and we really need to listen to that message. But the more important piece here was sharing that really strong message about civic power and how we as individuals at this moment can make things happen. So the book is called You're More Powerful Than You Think. Those that want to continue to have this conversation with Eric, he will be in one of the exchange sessions, so looking forward to that. We're going to take a 15-minute break, then at 1:45 go into the sessions and have some good dialogue there. So thanks, everyone. Have a great evening, afternoon, and we'll see you in the exchange sessions. Thanks, Eric.
Thank you.